Welcome to the last Health and Wellbeing Board of this municipal year. And before I start with apologies, we have got some new people around the table and some less frequent attenders, so I think it is nice to welcome them. So thank you, Jack, coming from the LMC, that's helpful. Siobhan, in her new role as interim CEO of Medway Foundation Hospital, so welcome in that role, Siobhan. Dominic Cox, do you want to give us a wave, Dominic, so everyone can see you? From the ICB, and Dominic tells me he's here for Adam today, but intends to be our more regular link, which is helpful. I'm grateful for that. And Victorian is from Marshall, from MCH for Martin Riley, so welcome. Victoria, I think you've been before, is that right? Or have you come for Adrian, sorry?
I'm afraid I've come from Adrian today, so I'm from Kent and Medway Mental Health Trust.
Okay, I beg your pardon, thank you. So I don't think we've got anyone from MCH then, because Martin has apologised, and it's Nicoletta Stangu's first board. She's here for the corporate parenting report, and last but not least, Inspector Alan Searle. Here for the community safety plan, which is towards the end of the agenda, and Councillor Alex Patterson will be joining us in his portfolio role, which is why it's near to the end of the agenda. And with that then, we've also got apologies from Councillor Coombs, she is on holiday, and from Jack Packman from Medway Voluntary Action, whose wife has gone into labour with their second child today. So congratulations, hopefully, to Jack and his wife. That's been waited a bit longer than they were hoping, I think he was telling me yesterday. And then Andrew Stradling from Kent and Medway Safeguarding. Are you all right, Eddie? Don't want any casualties, not at the start of the board. Thank you very much. That's it, yeah. And also, Sue, it's nice to welcome you here, of course, in your capacity to talk to us about the Better Care Fund, an area of speciality and something that's quite critical to lots of people around the table. So we've got quite a heavy agenda. I'm aiming to finish for 4:30. Leanne Farrick will need to go at 4 o'clock, so we'll just say goodbye to her then. If anyone else needs to leave a bit earlier, because we do normally try to finish by 4, then perhaps just, signal Stephanie and we'll let you go, because I do understand that it's a busy afternoon. I'm grateful for everybody being here. Okay. So, the record of the meeting of the 12th of February is our next item. You should have that with you. And just going through, we had the annual adults safeguarding report. We looked at our new adult social care strategy, which is in place now, and I'm grateful for all of the comments and suggestions that we had associated with that. And you can see we had a very wide-ranging discussion. We had a Marmotplace partnership update, and I'm delighted to say now the report from the Institute of Health Equity was launched just over a week ago, a really insightful document that is helping to guide us with our work with health inequality, and as people have heard me say many times before, held a critical mirror up to the work that we're doing and told us what direction we need to go in. I was on holiday actually for the launch, but I was able to speak to officers before, and I understand that the meeting went very well. So thank you very much for anybody here that managed to attend. And actually, we've got our first Marmot guided session coming on the 30th of April, where we're going to look at young people not in education or training. So really looking forward to that, and we've had a fantastic response actually to that particular summit, and got lots of people coming along to join us, people involved in that area of work, partners and other members of the council. Then we had an update on the integrated care strategy. And finally, we looked at the work programme, which is going to be quite heavy for the coming municipal year. We've got to get our plan for neighbourhood health in place and really start to drill in now to the work on health inequality, because we've got new targets for the Marmotplace. And I'm already getting lots of requests actually from people to come along and see us. So hopefully next year will be as interesting as it was last year. And I do thank everybody around the table for the commitment that you always show, thinking about what the board can do to support the things that we look at each time. Okay. Anybody on the record of the meeting of the 12th of February, please? Okay, are we happy to accept the minutes as a true record? Thank you. I don't have any urgent matters. Does anybody else? No. And are there any declarations of disclosable pecuniary interests and other significant interests, please? No? Okay. So with that, David, are you taking the item? So the next item, item 5, on page 15, is a bit of a review of the year on our performance indicators. So what I asked officers to do was have a look at some of the things that emerged as some of the kind of really quite careful looks that we've had at the themes in the Joint Health and Wellbeing Strategy. And of course, we now need to marry the Joint Health and Wellbeing Strategy up with what we do in neighbourhood health and indeed the direction that the ICB is taking, so that we make sure that the strands of work, all intended to tackle health inequality, actually match. So with that, thank you. David, over to you.
Yes, so thank you very much. Yes, so one of the key functions of the Health and Wellbeing Board is to produce a joint local health and wellbeing strategy that identifies the core needs for an area and the ways that we're going to address those needs. Medway's joint local health and wellbeing strategy was published in 2024 and runs up to 2028. It was developed in parallel with the Kent and Medway integrated care strategy, so there's lots of read across between the two documents, so that they're very much in sync. But the joint local health and wellbeing strategy gave us the opportunity to look at things from a Medway perspective. There are 4 themes in the strategy that don't just cover the core elements of health and well-being, but also look at the building blocks of health, the wider determinants of health. Those themes are theme 1, healthier and longer lives for everyone. So that's very much sort of around sort of the core health work. Theme 2, reduce poverty and inequality. Theme 3, safe, connected and sustainable places. And theme 4, connected communities and cohesive services. So over the last year, we've had meetings where we have dedicated the meeting to each one of those themes. So we've been able to look at issues in more detail. There's a lot of work that happens across the council, across the NHS, across the voluntary sector and other partners that addresses lots of different elements of the joint local health and wellbeing strategy. So it's not possible to cover everything in each of those meetings. But this summary report provides an overview of some of the key areas that we looked at and some of the actions that have been taken for those different themes. So, for example, we've now launched the Mental Health Therapeutic Alliance. We have formed a health protection team in the public health team, which is working with our health determinants research collaboration to develop research proposals around screening and immunisation. And we've done some insight work with adult social care staff around flu vaccination. We've worked very closely with planning on hot food takeaway guidance, for example, and we've made sure that well-being has been built into the local plan. And there are a number of other things. I won't go through everything. So that report just provides an overview of some of the in-depth conversations that we had over the last year, focusing on the different themes. And I'm happy to take questions from anyone on the report.
Okay, thank you very much, David. And we're very excited, actually, about the Therapeutic Alliance, which actually has come into being since 1st of April. And that is, we've commissioned that. I regard it as a piece of innovation. It's led by North Kent Mind and will offer strategies, therapeutic interventions to children and young people with mental health problems prior to diagnosis, so that on that journey, children and young people and their families have an opportunity to do other things than wait for a psychological diagnosis that can help them manage their mental health conditions. And this is absolutely, in my view, critical. As Dominic and colleagues will know, we've got very long waiting lists for neurodiversity assessments, and we're really hopeful that the Therapeutic Alliance can play its part in making those interventions. And the other thing that I particularly wanted to mention, since we looked at corporate parenting and outcomes for care leavers, we've been chosen as a pilot area for kinship support. So that means that we've got extra money for kinship carers, that is, family carers who find themselves in a position to have to look after a child whose biological parents can no longer take care of them. And hitherto, kinship carers were not entitled to the same level of benefit support and other financial support, for example, that foster carers get. And taking on a child, often in strange circumstances, when somebody is in prison, for example, when somebody, a biological carer becomes ill, it's a huge step for families. I've got personal experience of this from working in the justice sector, and those kinship carers deserve a lot of support. We were already supporting them, of course, across the council, but being part of this pilot, and it's got a long run, so we can really measure the difference that it makes, I think will help us keep a lot more children and young people out of care. So we're looking forward to how that pans out, and I think it will be appropriate, Kelly, at points to bring that to the Health and Wellbeing Board and see how we're getting on with it. So with that, any questions, comments or ideas, please?
Yeah, thank you very much, Teresa, and thank you, David. This is really, I get quite excited about reports like this. Teresa will probably realise it, with this connectivity across the board. I think one of the things that strikes me, just general point first, and I've got a couple of specific points to raise and an area of concern about the strategic approach to this. The openness and the transparency is clear so that anyone scrutinising can see what's going on, but I think also that and the holding to account as a consequence of that is written large in the way this is presented. But I think also that strategic linkage that you can then pull in. I just want to give a couple of examples under theme 2 in relation to topics 3 and 4 around particularly young people, but also people coming back into work. Literally next week we've got the Medway Skills and Employability Board meeting on their regulate, and those two in particular link directly to that piece of work that we're doing in another area, but it all connects up, and that's lovely to see how that thing about sustaining employment and helping those who are coming with mental health issues going into employment and keeping in employment. I mean, the Skills Board is looking at NEETs as well, so it's kind of all connected up there, which is really great to see. And the other one is in relation to theme 3 on topics 2 and 4, and this is in sort of my own portfolio area where it touches on school streets, and then theme 4 touches on active travel. And in those, the meetings and the boards that we have and the groups that meet around those, we talk now openly about all the health and wellbeing issues connected to delivering those areas of the council's work. So I think that kind of openness that has been created by doing this is really helpful. One area of concern that I've got is around the kinship care. And it's really welcome. I know Adam talked about it quite a lot as well, and I've had a chance to sort of do a bit of background. There's 2 areas really. One is in relation to what we might be opening up here. I think there's a huge amount more going on behind the scenes. The professionals will know better than I do, but I get the feeling there's a lot more kinship care going on than we can possibly imagine, and this will open that up, and we'll discover how much work is going to be needed in this area. And the other area, and I can't remember if it's been touched on before or not, is the kind of reverse situation where children are looking after their parents. Is this incorporated within this? Because there's a lot of that going on as well. So those are my 2 questions, really. Thank you.
Yeah, I think I can answer for officers. Young carers are not included in the kinship care zone. But Kelly, I don't know if you've got any comment to make, because you're right, Simon, there are informal arrangements that don't come to the notice of the council, and those people may now step forward because of the entitlement that the pilot affords them. So Kelly, I don't know if you've got anything to say about that, particularly in terms of capacity.
Nothing particular at this stage, but a big part of the delivery plan is around that communication strategy to ensure that we do capture those families. The kinship pilot will include any family that an order has been granted potentially by another local authority but have moved into Medway, so we have to identify those families, but also those unknown arrangements. But I think Councillor Murray talks about me coming here with an update, and I'm happy to do that regularly.
Chair, just to comment on your thoughts around children's mental health. I've recently had to deal with a case in my ward of a child waiting for an EHCP, and some really good communication with public health, so thank you for that. But what strikes me is we've known about a rising caseload over 3 to 4 years, but there's been no increase in capacity to deal with that caseload. And I'm just wondering, as a part of the strategy, we need to how quickly we can flex and move and pivot to actually deal with increasing caseloads. And I just wanted to raise the other comment about GP, the recruitment of GPs. It's absolutely essential. Without GPs, the neighbourhood care plan, I don't think is going to be that much of a success. And I think the last report showed barely 3 or 4 new GPs in the area, and we talk about innovation in the report. I just wonder if there's any update on what that innovation might look like and, you know, what the current targets are. Thank you.
So I've got Eddie and then Mark, but I'd like to come back on the GPs. Andrew, we have actually had 14 new GPs in Medway this year, but only 5 of them are full-time. Because GPs are like everyone else. They want to have a different way of working, and I think we should do our best to accommodate that. And Jack, you may have some insight to offer us on that when we've heard from Ash, please.
So, thank you. So, I think I must have done this in the past. There are 2 important things. So, one is the good news. The good news is this, that we have increased the number of GPs. So I was looking at the baseline recently, and what we did was we baselined it on September 2020 to where we are now. We have had a 30% increase in total number of GPs in Medway, as compared to we have overall in Kent and Medway, we had an 11% increase. So we've done far better in Medway than in other areas. Having said that, we have got a long way to go. We do recognize that. And so we're starting from a bit of a lower base. We've worked hard, we got to a place, but we need to keep going. So whatever things we have done, we have to keep working on them. And then we need to be more innovative to be able to attract. Some of the things which we are talking about with the neighborhood way of work and everything else, those are the kind of things which attract people to come in. And I think you're absolutely right there in saying that as a GP, a lot of my colleagues work in the acute response team. That means they work in the care homes and nursing homes, support those patients. Plus, then they work in the general practice. So they are sort of having a portfolio kind of a career. If we have good neighborhood way of working, you will be able to attract more people. So whatever we have done here is good, but I think we need to keep building on that. And the second important thing we have to remember is, when I became a GP, most of us were GPs in the practices. At that time, we did not have any other physiotherapists or pharmacists or other colleagues working with us. But times change, and the times today are more about talking about having a multidisciplinary team. And it's really good because my pharmacy colleagues know far more about these things than I do on some of the medications. Similarly, my physiotherapy colleagues or my mental health colleagues are far better on those things than I am. So it's important to have GPs because you need to have those GP colleagues there, but you also need to build a good multidisciplinary team around them. And that's the key in terms of how we look at it in future.
Thank you, Ash. And I'm pleased to say, before I ask other people to come back for you, Andrew, the Kent Medical School has got a new GP surgery simulation suite, and they welcome anyone who wants to come and see it. So that is raising the profile of going into general practice for our students in the medical school. And they've got all sorts of avatars and AI-enabled patients, as well as real patients who are actors coming along there to help them. On the issue of neurodiversity, and I will ask Dominic perhaps to comment, we've got a 1,000-day waiting list. And that, I'm afraid, is unacceptable. And we have made that very clear to the ICB, showing in the case of Medway particular regard for children who are waiting, because without intervention, those early parts of life are really, you know, being undermined in terms of children realising their potential. So let me ask Jack to add on GPs there just quickly. You don't have to, but if you have, we welcome what you've got to say.
I mean, I think I think, Ash, the ICB have commissioned a bit of work to look at why the low numbers are out there, and that report is, we're waiting for the outcome of it, which would be helpful, that would be useful. And I think, you know, some of this is structural, it's contractual. There have been some changes nationally in our contract which mean that there is more money kind of and resource flowing into the core bit of the GP contract, which allows GPs to employ, or partners to employ GPs, and that's not really been the case for many years. So and that's changing this year. So I think there are a few things that will help that a little bit as well.
It's good news, thank you, Jack. Dominic, have you got anything to share with us on the neurodiversity waiting list? I'm very, you know, I know the ICB are aware of it. I know that the structure has changed, the personnel involved, but it is an area of concern for us.
I'm aware that it's a big concern, and it's a big concern nationally, but I understand locally. I haven't got the detail on our own plans. I'm happy to bring that, do some work and bring that back and discuss that with the teams, given the priority.
That would be ever so
Yeah.
helpful,
Yeah.
and I think perhaps it would merit a separate look at, because one of the things, Dominic, that we were told is that obviously there are a number of providers, and it seems clear that people are on more than one waiting list. And I think if a piece of work could be done to analyse where that is happening and get people only on a waiting list for one provider, I think that would help, because I think it's causing, I can understand why people have done that, but I think it's causing confusion, and it probably is inflating, actually, the numbers on there. So if you can do a piece of work and we can work together to bring it back here, not, you know, in a timely way, I think that would be useful. Andrew, just quickly coming back.
Yeah, well, very quickly, just on GPs, it strikes me there's been an explosion in GPs working privately on doctor online types services. So whilst we've got 14 part-time GPs working, I don't believe all of the GPs working part-time are actually working part-time. They're doing other work. I've got no issues with that, but I think that's your challenge. You know, most private health providers are providing GPs online now because you just cannot get an appointment with your local GP. So maybe understanding of our GPs, how many are working in other sectors, might actually allow you to be a bit more innovative in terms of how they're working in that area. Can we bring that into local practice? Just on the neurodiversity, the impact not only on the children, Chair, but also on schools, trying to deal with children who have unmet needs. There is no money to support those children without an EHCP. Yes, there is some high needs funding and other funding, but it is really impactful on the learning of other children as well, where that need is met. And I wonder whether the ICB have considered the impacts of the SEND white paper and what that's going to do, because I think there's going to be even more demand for those types of services. It's just disappointing that we know demand's going up, but the contractor or the people doing the contracting aren't reacting to the growing demand. Maybe that's the problem with the 3 or 5 year contracts. I don't know. These things need to be looked at. Thank you, Chair.
Thank you, Dominic. I think we can wait till you come back next time, because it isn't fair to put this on you now. And on the issue of GPs, the ICB is doing the piece of work. So, Ash, I'm sure that you and Suk will bring that back when we're ready to see it. So I'll go to Eddie now, please.
Thank you, Chair. Andrew got there first, but I still want to... So I was looking at page 21, and when I read that sentence, a strong focus was needed on attracting more GPs to Medway. Officers acknowledged the importance of buying. Those words, a strong focus, that word strong, that's an attractive word. But it's a bit like other platitudes here, you know, like laser sharp focus. And I'm thinking to myself, what does that actually mean? Unless those words then translates into something to give it weight behind it, it's just words. So I was really pleased that Jack mentioned about the challenge of understanding why. I actually agree with what Andrew said just then about looking at other practices. So I'm just saying out aloud, for this because I'm wary, I'm not saying this is what is happens, but my concern always is, we can read reports, they sound good, but then the translation into those that can actually doing the hard graft of really understanding why we still appear to seem to have a not good enough supply of GPs in Medway. So I just want to support that idea. And the specific question is, this is obviously a review of themes. When will we actually see the stats and the text that presumably will follow up from this, please, Chair?
Yes, so there is a logical framework matrix that has a whole load of indicators that are linked to the joint local health and wellbeing strategy. So we are monitoring lots and lots of indicators. We could bring a report summarising where we're at to a future meeting.
We did see those at the beginning when we started, and we've seen them periodically, Eddie, when we've looked at each of the different themes, just reminding you there. Okay, thank you.
Thanks very much, Chair. I wanted to briefly touch on a couple of the items in the report, para 4.2 on vaccinations and immunisation programmes, because this is so topical at the moment. We've not only heard about the COVID report today and the need to counter adverse social media and messaging, but also, of course, we've had the recent meningitis outbreak. So I just wanted to make a plea for the second bullet about more work needed to be undertaken in family centres, awareness and increase update on vaccinations. And if I'm not wrong, I believe family centres also have a role to play for young people going on through their teenage years. And as I say, that's very topical at the moment. We need to counter adverse publicity about vaccination. I then wanted to go to para 4.4, the cancer screening programmes, and wondered in terms of bullet point 3 on 4.4.1 what work the Public Health Director thought was needed to be done to increase access to screening for under 45-year-olds. It does say, that paragraph, that screening rules are set nationally, and we've had a reduction in the age for routine 2-yearly cancer screening now, but that goes into the 50s, not the 40s. So I just wondered what we might be doing for under 45-year-olds. I've seen general advertisements on these electronic screens in the high street, general information of that sort, but how many people under 45 are taking any notice of information on bowel habits and what have you? Thank you.
Okay. Thank you, David.
Yes, so specifically on the screening, so for as the bullet point says there, the screening rules are set nationally. It's not something that we can change locally. And that bullet point was something that came out of a conversation within the Health and Wellbeing Board, a suggestion that we should look that there are people under the age of 45 who are also at risk. It's something we can have conversations with national colleagues about, but we would need to be able to demonstrate the case, and ultimately it's not set locally. It's not something that the best we can try to influence it.
Mark, just as well for the board's information, we have had 1,000 hours from the ICB on mobile vaccinations going into trusted places and places with low take-up. That's been quite successful. I've been very involved in that because it's been run by Carson's Pharmacy, which is my local pharmacy and one of only 2 that offer very long opening hours in Medway. And actually, the results are really good. And I'm very pleased to say that the ICB have, again, commissioned the mobile vaccination. They will include Swale this time, and we've got much earlier planning going on. Because you're absolutely right, we are an under-vaccinated population here, and we do need to do as much as we can to get people taking up what their entitled to. And we await to see, Mark, on meningitis. There will be a full report over time from the Health Security Agency, and that will give us some insights into what happened. But I don't particularly think, as a layperson anyway, but someone who's been involved, that there are going to be any great surprises. But it is something that we've got to watch. Okay, I think, yes, sorry. Please, Victoria.
Thank you very much, Councillor Murray. I thank you for these papers as well. There were two opportunities that really stood out to me when I read them. The first was in respect of homelessness. So Kent and Medway Mental Health Trust has been greatly extending our homelessness services over the last year. As of yesterday, we had 43 people in Medway who are being supported by our teams. We've also done a lot of work with our trust charity to work with our homelessness charities to provide additional support. That can't happen, however, without good contacts in the Medway area. So if services in Medway are aware of people that are homeless that need support, please do let us know, because actually it will be this community that really does raise the profile. The other was in respect of the self-harm statements within the paper. Kent and Medway Mental Health Trust has just launched its new trust strategy, and self-harm in the community is going to be one of our breakthrough objectives for the next 12 months. We're 16 days into the new strategy, and already Medway Public Health team has reached out to ask if we'd like to do some mapping in respect of what's going on in the community here. So a little bit of a thank you, but also an opportunity for us to work together next year.
That's very welcome, thank you, and something else that we could consider for the board when the new strategy has had time to bed in. Okay, so, sorry, Jackie, I didn't see you.
It may already be happening in Victoria, but because I know that my teams and KMH are working really well together, but I think I'd like to link in our Medway Intensive Support Team with you, so we work closely with rough sleepers, homelessness, those on the edge of care and suffering with mental health. There's lots of links, so it might be, but it'll be worth us catching up if that's okay.
We'd love to, Jackie.
Yeah, and I think, just a moment, Eddie, we've got a report coming to the Combating Drugs and Alcohol Partnership about the operation of the winter shelter, and thinking from that angle how we can do better next year on that. Just quickly, please, Eddie.
Yeah, this is a question I've only literally just thought of it here in the conversation, because I was actually asked the other day, how come there doesn't seem to be any more homeless along Rochester High Street? And I couldn't go, it's because of this. I was just wondering what the answer to that is. I mean, hopefully it's indicative of people getting the support and help that they need.
I think the answer to that is exactly that, Eddie. We're trying very hard. Don't forget, we've spent a huge amount on temporary accommodation and strengthened the rough sleepers team. So if that's turning a result, that's very good news. Okay, so next time you see that person, give that answer, please. Thank you. Okay, everybody, I think that was a useful comment. A couple of things there to take away in terms of bringing back statistics, which I think that's important. Have a look at the log frame again. We'll make that happen. To look in detail about neurodiversity, Dominic, when you're ready to do so, and to hear from the ICB about the piece of work that they're doing on GPs. So, okay, with that, I'm going to move to the next item then, and that is the ICB's Recovery and Transformation Programme and outcome of the formal consultation. So can I say, Dominic, thank you for the response that was made. It's in the papers to Medway Council. We responded formally to the consultation. And I would say to the board, please, this is at a very early stage. We haven't got an organogram or the kind of detail that I can understand that people want, because we like to know who's who and those people that we're working with. And I know that clinically you've got 4 areas, Dominic, which might be worth mentioning because they're not explicit in this report. And I think from me, and I'm sure from other people in the board, we want the new structure to work. We recognise and accept that you have been asked to reduce costs by 50%, but it is not the case that we've got an expectation that services to people will be reduced by 50%. It was a particular drive to cut down the number of staff. I think as well it's worth acknowledging we know that this has been a difficult and painful time organisationally, and we wish everybody that has left the organisation well, and are optimistic and hoping that we can support those of you who are left and wanting to make this work. So with that, I'll let you come to the report. Thank you.
Thank you. Just checking the technology. So, yeah, and just in terms of where we are in process. So, and thanks very much for the comments. So I think we had 400 comments that came in from staff and partners around the consultation. So they were all taken into consideration, and the structures have been communicated back to staff and also partners, I think a couple of weeks ago now. There is still work, as you can imagine, which you alluded to, in terms of populating the structure. And the plan is that we get to a point when the structures are there by the end of Q1, so in terms of end of June. So there's still quite a bit of work to do, but the consultation obviously was helpful, and in terms of the direction moving forward. I'll take the paper as read, but I'll bring out some key themes which were in the paper, but to bring to life about the change and how we're going to work moving forward. So the big focus is on the ICB really improving its quality of commissioning in terms of the system. And we call it strategic commissioning. It has been called this before. But my sense is there is a lot more momentum now and profile nationally and locally to make this different. And the key themes of that, and I do think it brings our joint working between the NHS and councils together, because there's more of a focus on population health and in using the information that we have. How do we address inequalities? And being more long-term in terms of our outcomes, which result in us being clearer on our commissioning intentions moving forward. We've all been around in terms of systems who have done that, but I feel as though there is a real big push now that we can be far more proactive and clear in our approach of commissioners in terms of the system. So what that's built on, and you referenced it, is the organisation is going to be aligned around 4 commissioning multidisciplinary teams. So focusing on elective, cancer diagnostics will be one area, urgent care and flow, primary care and community, and mental health and learning disability and autism. Now, we completely recognise that there are independencies between those different areas, because if you, example of elective care, a big focus is on GPs and how they, the demand and how we address some of the clinical variations. So we recognise that, but it gives a real focus on those 4 areas. So teams will be aligned around that. So as I suppose previously, individuals working quality, clinical, procurement, finance, they will still have their areas of expertise, but they'll be working far clearer in that, supporting that clinical way of working. And Ash and colleagues, it will be clinically led, so there will be some clinical leaders working alongside directors to really make that move forward. So that's the key approach and how we're going to do. What it will necessitate and focus, and you'll get to know how I work, but really close and improved collaboration in terms of how we work. So in relation to how we work together with councils, providers, GPs, voluntary sector, our communities, so it really pushes us into a very different level in terms of understanding the needs of our communities and what people are telling us. We clearly do still have statutory responsibilities in terms of, example, send and safeguarding and structures. We've maintained capacity as we can do in terms of ensuring that those responsibilities are met. I think the big challenge, I suppose, in how we work, and there is a reduction, as we've talked about, in terms of the cost and the number of people, but this is about us working more effectively. And we recognise, I think we'll all recognise, there are improved ways of working, about us being more joined up and more aligned, and that will really drive us sort of in terms of how we're moving forward. So just from my experience, I'm bringing that experience in terms of how we bring the teams together. It's a big cultural change, you know, in terms of how we work, but we're putting time and space in for the teams to be able to, you know, operate and work in a different way, because I think that's essential for us to be able to move forward. Just a reflection for me coming in as well, I think there is more we could do in terms of joint commissioning and opportunities. I know there's probably been some work that, but if you think about us all strategically commissioning and being able to be more long-term and more, have more intent, bigger focus on outcomes, I'm sure there's more we could do in that joint commissioning space. So happy to reflect on that. Obviously you all have the, well, what we've done so far, what have been some of the barriers, but I think there's an opportunity there. So I'll stop there in terms of the overview. I recognise that there was a detailed response, which thank you again. We responded back in terms of, you know, in terms of the assurance that we give us at a point in time. I'm happy to respond to some of those if there's issues that you wanted to pick up. But yeah, so we did take that into account. But as you said, there is a challenge that we've obviously had to work within as well in terms of sort of resources. But we challenge ourselves to work differently. Yeah.
And I think, Dominic, on the Council's response, we'll take that through the leadership structures rather than take it here, because I want the board to have an opportunity to give their comments. So with that, I'll open for comments, please.
Thank you, Chair. It struck me, I mean, just listening to you, Dominic, it all sounds great, but you talk about culture, and that's going to be the culture of the organisation, the culture of the people working in it, the culture of leadership. That takes years to change. You've got to get this all in place from the 1st of July. So the sense of the report that came back from Natalie Davies is a lot of good intent, a lot of fluffy public sector type statements here, but there's none of the how. How are you going to deliver this? I don't get any sense of the how. And they're really my comments. And, you know, we've heard this about the neighbourhood healthcare plan. All of a sudden we're going from, you know, command and control from the centre to all of a sudden all these people acting on their own without, you know, direct leadership. You know, I just don't see how any of this is going to happen in the timescales you've got. But anyway, I did have some specific questions. So just on, obviously, the point on the reduction in people, I'm just a little bit worried about the impact on delivering statutory responsibilities and which ones you deem most at risk during the transition period. Medway obviously has a high need population, but I'm just wondering how you'll ensure that the system-wide standardisation of services does not inadvertently lead to loss of local sensitivities that actually, you know, direct the needs of the Medway population. There's a section on cost shifting. I'm just wondering how you're even going to do that, because I understand that's quite a bit of a problem at the moment where the council's bearing costs that the ICB should be bearing, and, you know, if you've got any comments around that. And then my other, one of my biggest concerns, this is generally about healthcare in Kent and Medway, is the issue around leadership. We've just lost the CEO of Medway Hospital. I don't know if any of you have seen the report about the treatment of the CEO at East Kent. And you've lost your CEO and your chair in very quick succession with almost no explanation other than a period of reflection. So I'm just wondering what steps the ICB are going to take to strengthen governance at board level to make sure that execs are held to account so that you can deliver this transformation plan. And we're not going to be facing in 2 or 3 years' time a great big deficit that comes out in a board meeting at the very last minute, and actually none of the plans actually get delivered, and, you know, the council's left picking up loads and loads of pieces. Thank you, Chair. Sorry.
There's a few things there for you, Dominic.
There is a lot in that. There's a lot in
and,
it. I get that.
I'm sure that David will step in as much as he can if he needs to.
So let me try. So and Ash may want the consultation. So we have statutory responsibilities which we need to meet. So we've maintained capacity in those areas when we have statutory responsibilities. So I think that's really important. We haven't, said we've got statutory responsibility, but we're not getting anyone to do it. So we've done that, and that's a process that's worked through and consulted with staff. I'll take you in terms of the challenge around delivery, because when I said culture and behaviour, I get in terms of the medium and longer term. And I'm not going to say by the 1st of July everything's going to be perfect and we're all going to be working in this great way. But what we are doing is we recognise. So I'll just bring to life. We're having, so in terms of the MDTs, we are very soon bringing together the leaders. We are bringing together the teams. We are giving them some space because they need to work through, and get the ownership about how to work. But we're also giving them some tools about, in terms of analytics, some of the enablers. We recognise that needs to improve as well, because you can't run these things without information, without having proper budgets and about. So there's a lot of enabling work that needs to happen, which is why it's a full organisational teamwork. So it will take some time, but the MDTs will be up and running. So in terms of meeting and having leadership and people in post, as we go into, as I've said, at the end of June, 1st of July. So we are making sure that the teams are there. But there will always be, in terms of getting the right behaviours and, taking some time to do that. A key challenge for us early on, and I'm putting that into the team, and I'd want you to be able to see that as evidence, is the commissioning intentions for this year. Okay? So I won't go into what happens generally in the world and how they work through, but as a strategic commissioner, we are going to spend time in terms of really understanding, and we'll do some of this collectively, understanding the population, understanding inequalities, and trying to be clearer on what are the priorities. So what are the priorities for, giving a colleague in terms of the mental health, what are the 3 or 4 big things that we feel that we should be tackling together? Now, my sense of commissioning intentions, I haven't been involved in this patch, but other patch, you can have a massive long list of stuff. So we need to be clearer on priorities in terms of what we do, and then working very closely with providers about how we deliver that. There is a direction, and as well, about the providers working closer together as well, which, in terms of the local providers, and that's a big part, and the same with the neighbourhood health. So you're right, it relies on the system working in very different ways, but I think there is a enthusiasm and about the opportunity it brings, and we're going to talk about neighbourhood health. I think a lot is based on that, but I would expect, and I'm happy because I'll be coming to this group, that we can have a different conversation about commissioning intentions in September, October, which will drive the future. Now, it won't, again, be perfect, but it will be in terms of how we move forward, because I think that's a real important test for us as an ICB, and would want to get that moving over the summer, if that's helpful.
Okay. And just on the governance point?
So, being recognised, they'll change. I won't go into the detail of everything, and obviously can't. But there's been changes in terms of, as you'll know, in terms of the processes and in terms of the way that we, in terms of working and some of the individuals. So that is move forward. But I'm not going to give a comment on that. But,
the general comments, when I looked at your board structure this morning, it's full of people in healthcare. Now, I know that might be a good thing in one regard, but actually, I just wonder, is there a danger of an echo chamber? That actually, where is the real holding to account coming from? Because there is no public accountability for the ICB. You guys operate in your little space, and there's lots of 5 or 6 levels of reporting above you, ultimately to NHS England, which supposedly doesn't exist anymore. But who is actually holding execs to account? for the delivery of your transformation plan?
So the accountability is still through, in terms of through the NHS England and the department. So that's in terms of the accountability. And there is a big, and this is why I think there is more impetus in terms of strategic commissioning. There is a big push. This isn't just in Kent and Medway. No. This is a big direction. I think there is a recognition that commissioning hasn't been supported well in the past in terms of giving individuals the skills, expertise and development, and that is what is happening. There is a big national programme to support that, of which we will be part of. Now, I would hope there would be some benefit as well for the working that we have, and there might be some opportunity and offer we can step into. We're not at that point yet, but there is a big push nationally that we're working with, and we'll hopefully ride that momentum. Okay. Cheers, Tom.
Thank you. Councillor Lawrence, one of the questions you asked is about areas like Medway, Thanet, South Kent coastal areas, which are coastal areas, have got more deprivation. Will they get missed out? Sort of a reassurance on that. The key thing in terms of the MDT way of working is we need to have people who are population health experts and analysts with us. So as we're developing our neighbourhood plans, so the key things which we have taken is identified areas where we have more deprivation and we need to have more resources in those areas. So just to give you as a sort of a reassurance, we do recognize the health inequalities, we do recognize the deprivations in various parts of the Kent and Medway, and as our plans develop, we will be able to target them far better than we have in the past, because we have the right kind of people in the groups to make those things work.
Yeah, I mean, I think that's absolutely right, Ash, and the steer from Stephen Kinnock on neighbourhood health is very clear, isn't it, that it needs to be deprivation-led. And I think, Abigail's nodding, that's for all of us to take up that mantle. Simon, please.
Yeah, thanks very much, Teresa. And I mean, when I was going through this, it was trying to pick out some key words. The first one was collaboration, and the second one was trust. And I think just in those two areas, firstly, I think being a bit parochial, this board and Medway Council and what we have to do through this board, I think we're going to have to trust yourself and Leanne and David that the relationship with you, Dominic, is really sound and that you've got your hands on in terms of how this transformation is taking place and it's going well. And then we'll hear as a board. And I think that's a good place to be. That's why this board exists. So I think from our point of view as members and as a council, we will get that feedback on the process from July the 1st, which is looming really fast as well in terms of how this is going to work. I think the other word that popped up was accountability, and Andrew's touched on that. I'm a little bit concerned when you say it's NHS England, which is going to be closing down next year. And how does that transformation then match with yours? That's a key question about the accountability and how is that going to work, and I'm not clear about that at all. I'll stop there for the moment if you want to come back on that point.
So yeah, so on the, we'll have to work, so obviously in terms of the joint approach, so in terms of, I suppose on the 1st of July, I won't be coming back and giving a commentary on the structures. I suppose that's just, in terms of we will be at a point then, and won't we have we've agreed that populated and we need to move on. Over the summer, the first really joint work will be how do we, looking ahead in terms of our commissioning intentions. I think, so I'm really committed to that is some joint work and how we move that forward. So I think that will be the first test, won't it, of how we're working, and happy that we do that and bring that forward. In terms of the accountability, I mean the department. I mean, I'm not embroiled in all of this. So the Department of Health, so the ICBs will still have that reporting and accountability to the centre. But there is a big push, and I think which is the comment I said to Councillor Lawrence, is that there is more of a push now of the ICBs really moving forward with strategic commissioning nationally, because recognising that it's so important to the, the future of working and systems and outcomes. So we've got to get better at it across the country. But that reporting, I mean, at the minute, there will be people still within NHS England, but you're right, there'll be change. But there will always be that reporting into the centre at the department. So, yeah, it's not, we're not just going to be left and, as I'm, that accountability is still there. Yeah.
Thanks very much. That's helpful. Obviously, it's something we need to keep a very close eye on as to how this emerges and what new structures are going to come as of next April and how that works. The other area, and obviously this is having seen transformation programs, I don't think I know of any transformation program that has worked. I think they all take longer than they planned, they all cost more than they planned, and they have to be flexible and they have to be changed and manoeuvred as they go ahead. So I think we're in a world of openness, transparency, and collaboration comes back in again. This is something that the ICB can't do alone. It has to do this in partnership with all of us around the table here and with the NHS, obviously, as well. So that openness, when things are clearly not starting to go in the direction you'd planned and we're not working, then we need to be talking about it and bring it. So I'm hoping that that's where, again, why this board is so important, that we hear about it and we can be flexible and working and collaborative in how we approach this, because transformation plans do not go smoothly, ever, as far as I'm aware.
I think that's absolutely right, Simon. And look, we live in the real world and we sort of know there's nothing new under the sun, don't we? But there have been some commissioning hiccups in the lifetime of the ICB, and I can understand why a focus on better, more rational, collaborative commissioning is part of this. And as I said before, this is an early look, and we're grateful to you for giving. Did you want to come in, Leanne? No. We're grateful to you for giving us an early look at this, and we want it to work. So I think the openness that Simon has described is a critical sort of pivot from perhaps previous ways of working, that when something isn't going as well, we tell each other and we get, roll up our sleeves to nail it down. And I think, unless you want to add anything else, Dominic, that does bring us for now to the end of that. Okay, thank you. Councillor Patterson here now to join us. So, Alex, if you want to come and take your place next to Ian, that'll be great. And, sorry, yeah, I'm just calling Alex up, yeah. I'm going to ask us to note the last report and the sort of element of it that's, like me, a work in progress. And think about how, particularly linked to the next item, we make the new circumstances work for us. So is everyone happy to accept the last report then? Thank you. Okay, so I'm going to go on to neighbourhood health, and after that we'll have a short break, okay, to give everyone a bit of comfort and let us all settle down for the rest of the agenda. Thank you. David, I asked for this to come because I wanted to keep a real focus on what is happening. And the last time we met, the documents that are referred to in section 2 of the report were not available. So we were going a bit blind when we had the first training session into what was required. But we're much better now in terms of the guidance. Abigail, I'm sure you'll have something to add to this. We'll be pleased to hear from you. David and I have attended training together. We are tooling ourselves up to get the plan done, and we'll probably have another training session for the board when we feel that we've got everything that needs to be in a row. But this is an opportunity to do in the wider health and care community what we do here, and that is work together to get something going. So with that, I'll hand over to David, and then Abigail, perhaps give you an opportunity in your role in the ICB for neighbourhood health to make a few comments. Okay.
Great, thank you very much. Yes, so as Councillor Morris said, we have brought neighbourhood health to the Health and Wellbeing Board a couple of times now. The last time that we brought neighbourhood health here to the board, we were expecting to have to produce a neighbourhood health plan by May. but we didn't really have any guidance. There was one sort of draft document that I'd managed to get to see, but we didn't really have a lot of guidance to work with. So we had a broad idea of what we thought needed to be in the plan. Since then, the framework, neighbourhood health framework, has been published that makes things much clearer now. Just looking at my notes here, there are a number of specific requirements for the ICB, particularly a minimum set of interventions around frailty, people with multiple long-term conditions, children, young people, and cancer. So this is likely to be sort of an initial focus of a neighbourhood health plan, but that's the minimum set, and there are other things that we can put into the plan. The framework guidance acknowledges that we can't boil the ocean, we can't do everything all at once, and that we will be learning as we do it, and it'll be a bit iterative and lead to improved plans in the future. There's a stronger link with the Better Care Fund, and there's a paper on the Better Care Fund that following this paper. And in terms of what we need to do, for 26-27, we need to develop an outline plan. But then we're going to need to produce a full plan for 27-28. Now, if that full plan is going to be useful for informing commissioning in 27-28, realistically, we're going to need to have it ready by probably about September. So we're going to move very quickly from thinking about 26-27 to moving to developing a full plan for 27-28. We've got this developing neighbourhood health plans really represents a real opportunity for us to, coming back to Councillor Lawrence's question earlier about how we're actually going to make this stuff happen. The neighbourhood health plan is going to be really key in demonstrating that. It gives us this opportunity to do things differently, to improve delivery and efficiency. And I think we've got a very good foundation at the moment with the Neighbourhood Health Programme Board. We've got lots of partners involved. It's been a very collaborative, open discussion as we've been developing things. So I feel quite confident that we're starting off in the right way with developing neighbourhood health across the Kent and Medway patch. So the paper that I provided is really sort of a summary of the sort of key points from the neighbourhood health guidance. And as I said, the next steps will be to work collaboratively to start to flesh out the initial plan for 26-27 and then the more detailed plan for 27-28. I don't know, Abby, if you want to add anything.
Thank you. And thank you, David. Yes, so we have not been waiting for this guidance as Kent and Medway. We have been going ahead of this guidance because we know that this is such an important agenda. But the guidance is helpful. So as David mentioned, we had established back in September a neighbourhood programme board which has all the partners across the system, including the VCSE, including ambulance trust, police, etc., so that we had all the leaders of those organisations working around neighbourhood programme collaboratively, which has been a really positive group. That group has established a top-level strategic model of neighbourhood model at rapid pace through December, and that now has been collaboratively agreed across all stakeholders. We've also agreed footprints and some principles about those footprints, again, at great pace with a lot of collaboration, because the beauty of Kent and Medway, just harking back to the earlier conversation, is our ICP footprint has not changed. So there's some really positive things in Kent and Medway that allow us to move at great pace. And the other positive elements are that we have a single community provider, we have a single mental health all-age provider, we also have a very proactive LMC. So there's lots of positive things that gives us a very solid foundation in which we can now work collaboratively. We have recently carried on sustaining what we have in terms of CYP, MDTs, which are flourishing in Medway, but we want to go further. We are absolutely looking at, as required nationally, at frailty and elderly, and this is now, but obviously seeking to move faster on multiple long-term conditions and cancer. This year, we want to start making more inroads into those groups. We have run 4 engagement events. They're very strategic, top level across the 4 separate areas recently to try and bring, and particularly the VCSE were very present there, and members of the public, to bring them onto this journey. But I think the key thing for this group is that the guidance was really, really clear in a helpful way about how important the collaboration between us all at the Health and Wellbeing Board is going to be absolutely essential and critical, and maybe a good litmus test of can we work well and collaborate together. And I think so far we have, but the new onus on this board around neighbourhood health is going to be really helpful and will evidence how we can collaborate together.
Thank you, David and Abby. So I hope that the board can see, you know, we're on a journey with this. And I have to say, Abby, at the consultation session, one of the things that I thought was emerging quite strongly was a will amongst practitioners to say, look, we're already doing some of this, and this is how we do it, and we don't want to lose the impetus or the efficacy of the things that we're doing, but we recognise that we're being asked to put it into a particular format and to deliver it. So, you know, it's not wanting to lose the level of collaboration, it is wanting to build on it. It's about that closeness to people. But I think there's a way to go in making it relatable to people, because the word of the use of the word neighbourhood has been used a little bit loosely, in my view. It doesn't mean the same to people who live in a neighbourhood that they call the place they live, as it means to lots of us around the table, to strategic commissioners, to clinicians, and actually to people in Medway Council. So I think if it's going to be successful, and if the public are going to have faith that it will make a difference to them, there's a job to be done in communicating that element of it, and hopefully that's something that from the Health and Wellbeing's point of view, Health and Wellbeing Board's point of view, we can make happen because of the relatability and the collaboration that's already here. So I don't feel pessimistic about this, I do feel optimistic, but I don't want practitioners to feel that the good things that they have done are somehow being set aside to do something new, because it isn't like that, is it? It is actually taking a lead from some of the things that are happening and, in fact, wanting to mainstream those things. Ash, you wanted to come in.
Thank you. Thank you, Councillor Marie. Just building on what David and Abby have been talking about, the good thing in Kent and Medway is that we weren't caught on a wrong foot, because we had an inclination, and it made actually good sense. The kind of areas they have gone for is the same kind of areas we have been working on. And as you said, Councillor Murray, we have got some very good examples of some good work which is happening in Kent and Medway. So we don't want to put that aside. We actually want to build on a lot of good work which we have done. And the good thing is, it's not just about focusing on our children, young people, which we have to, or focusing on mental health, which we have to, but we also have to focus on our most frail, most vulnerable patients. And I think you would have heard me speaking in the previous times which have come in, is one of the key areas is, you'll be surprised, is that almost 60% of the patients who are in those corridors of the hospital, it comes from this frail elderly population. So we need to do something different from them. So one of the plans which we have for the neighborhood, which we have been building on, is how do we look after this cohort very differently? Also in terms of, for example, how do they have the respect plans done so that in the midnight, the ambulance doesn't take them to the hospital unnecessarily, or they have their medication reviews done, all of those things. But not only that, we also want to focus on the rising risk. That means if somebody has a hypertension, somebody has a diabetes, how do you prevent that from getting worse? So the plan which we are developing encompasses all of them. But as you said before, or I think, David, you said is, we can't boil the whole ocean at the same time. So we have to factor in what do we do today, and then what do we do with sequences. The way we are describing it is a sort of a multi-phasic program, is that you go with the phase one, and then you quickly do the other phases behind that, so that you are able to target the population in a clinically safe and sustained manner.
Thank you, Ash. And I think for me, not just in this role, but in my role on the council more widely, the critical part of that is to make sure that the voice of adult social care is heard very loudly and clearly in the centre of this. Because if we are starting to, move to a position that we've seen work to an extent in East Kent, but not completely, where people are maintained in their own home, then the involvement of adult social care, the capacity of the workforce within it, and indeed the living circumstances of lots of those people fall on the council. And we have to have assurance that the constraints and resource challenges that we face are taken into account before that happens. So, that's where collaboration is going to be tested, isn't it? Because we'll have to put things on the table and put our hands into them together in a way perhaps that we haven't done before. And I think that is really important to remember. The other thing that isn't mentioned very much in this report, but is critical to the success of neighbourhood health, is the prevention agenda. So we need to make sure that the neighbourhood plan from this board weaves in what is happening to prevent people getting ill in the first place, and recognises the resource implications for all of that, and obviously that's the bit where we're most likely to involve the VCSE, I think. And, there are all sorts of workforce issues about equity between people who work in adult social care and people who work in healthcare, because there will be an expectation and a higher demand on adult social care workers, particularly in this area of frailty, and that is there to be faced. That isn't explicit in anyone's plan because the question's too hard for a lot of people, but we've got to see what we can do to tackle that, I think. Okay. So, something else to look forward to. We'll do another training session for the board. You've heard a timeline from David and Abby there about how this is going to work. Absolutely, Siobhan, it goes without saying that it involves your workforce in a very material way, but I think we've got strong enough relationships now in terms of discharge to make that work in the way that we want to, but there's, a change coming, particularly, I think, for the way we'll be expecting people who work in the acute setting to work in the community as well, and strong awareness of the fact that that needs some managing, but I'm sure you've got broad enough shoulders. Okay. So with that, we've got lots to look forward to and more to come back on. So unless there's anybody else, I'm going to close that item, give us a 5-minute break to get a cuppa, and then we'll move on to the Better Care Fund and all the things associated with our lovely guests here, with the Community Safety Plan. And I think, Alan, with you, it's a really apposite day for you to be here, because neighbourhood health collaboration will absolutely involve, some co-location, some really serious joint working around some of these more complex people who keep rocking up within the health service, and lots of them are known to you. So, okay, thank you. Yes, and as Stephanie said, I don't think there's much to say. That's it. Edging away, Eddie. My definitely weakest point, but anyway, thank you, everybody, for that. the next item is the Better Care Fund, and it's the plan for the use of this very significant fund for 26-27. Mindful that it's a joint plan with the ICB and the Foundation Trust, and actually it's a genuinely pooled budget. And I think that's, you know, one of the things that we can think about is that we have got some practice associated with using a pooled budget by agreement through the Better Care Fund. We're just being asked to note the report. I do remind people that we have to submit the Better Care Fund report. We have to explain how we're going to use the money and get approval. And I do thank you, Sue, and the team for the way that you have always been able to obtain that approval in a timely way. And actually, the way that the Better Care Fund has been used in Medway has been flexibly. And we've been able to step in using support from the Better Care Fund to make new things happen. And the integrated support team, the Medway integrated support team, our MIS team, is a really good example of that. You know, that is not something that we had at the outset of the first year, but it is something that we were able to weave into the fund and make sure we got support, and very successful it's been too. So with that, Sue, I'll pass over to you. Thank you.
Thank you, Councillor. You've done an excellent intro to the paper. So I'll only add to that the focus for the plan is under 9.6. The oversight of the plan is done by the Joint Commissioning Management Group, which is a mixture of both the ICB and adult social care. It is framed together by the legal agreement of a Section 75, not just to pool the budget to make sure that we jointly administer it. And the Health and Wellbeing Board is our oversight board. The metrics that were in section number 3 shows you the drive that has been given to us by the guidance this year, which is to make sure that care moves closer to the community, improves prevention, and to ensure that the support living independently. And I'll take any questions. Thank you.
Thank you very much. Open to questions now then, please. Andrew, thank you.
Yes, thank you, Chair. I was just reading about the stretch targets and the miss for heat waves and flu. The flu one's fairly obvious, I think, to everyone. But I was a bit surprised by the heat wave one. I just wonder if there was any numbers behind that, just to give us some idea. And I suppose the follow-on question, what contingency do you build in to the budget for an unknown event down the line? Is there anything that I mean, I know, for example, they do a lot of forward scanning on the type of flu that we might get next year. I mean, is there anything that we're doing in that sense? I just had two other questions actually, just on the delays on hospital discharge. You know, I'm just wondering what extent that was due to lack of assessment beds versus lack of domiciliary care available to the council. And just finally, on the VCS infrastructure, given the ICB cuts that we discussed in item 6, I'm just wondering how we're going to protect voluntary sector partners who are delivering that really high quality but relatively low cost support to our residents. Thank you, Chair.
Thank you. And just to remind, Jackie wants to come in on this, Sue, so if you answer first, we'll hear from Jackie afterwards, okay?
Okay. Okay, thank you. So forward planning for anything like COVID and meningitis and things like that doesn't fall under this BCF plan. It's more under the joint health and wellbeing strategy. This particular plan looks to do solutions that do the discharging, living independently, such as intermediate care and reablement, our community equipment. We do have the VCS contracts, which are also enablers for the emerging neighbourhood health. So that means that we have like Carers First and Health Watch and the Kent Association for the Blind. So we have enablers. That's what the BCF does. It enables that. We also, out of the BCF, have the discharge team. So we're funding those. The question around discharge and why there are some delays. I know Jackie's going to come on but there's wider factors than sometimes is obviously seen. But the move towards, we've just, thankfully, by Cabinet, just approved our commissioning for the intermediate care and reablement, which was a much bigger and wider service this time round. So that will also assist with improving discharges. There's also an awful lot of transformation being done within that local health and social care system around discharge to improve it, including a introduction of a care transfer hub, they call it, but it's just to make sure that people go out on the right pathways in the right way and receiving the right care at the right time. Have I answered all of your questions other than the beds, because Jackie's going to come in on that one?
Yeah, just on the VCS.
The VCS is protected through our contracts, and we don't have a pot aside for emergencies, but we're always willing to look at whatever we have within the system to flex to meet any change that's required.
Yeah, thank you. I mean, Sue's covered some of it. I just wanted to sort of comment specifically around the delays. Are they due to domiciliary care providers? And absolutely not. We have no problems at all with the capacity in the domiciliary market in Medway. There are always queries about assessment beds, and over the years I've been in this job, should we have them? Shouldn't we have them? If we do, how many should we have? And we've been talking about actually there needs to be a specific dedicated piece of work that really looks at actually, if we introduce more assessment beds, does that have an impact on people coming out of hospital? Is it the right thing to do? But also considering neighbourhood health and actually wanting people to be in their own homes, is it right that it's a blend and we have some increase perhaps the beds slightly, but look at an enhanced home first model, which means that we can get people back home rather than into a bed of a sort. So it's finding the right mix for the right people.
And you can see at 9.4, that's where the specific allocation has been made to try to make that happen. Anybody else, please, on the Better Care Fund? Okay, so thank you very much, Sue, for your work on it, and congratulations in terms of approval again, and we look forward to how we're going to make that work with neighbourhood health, I think particularly in the area of reablement. Thank you. Okay, so over now. Yes, we can agree the recommendations. That would be very helpful to Stephanie particularly, and also to me, laid out at 1.1 and 1.2. Thank you. Okay, everybody? Yep, right. You would like to introduce this item, please, as portfolio holder, and then we'll go to Alan and to Ian to make any comments that you'd like to. And I do, commend to the board. Being safe in the community and feeling safe is a key plank of health and well-being. That's why you're here. There's recognition. It comes up very strongly whenever we do any kind of surveys, that feeling safe contributes particularly to people's mental well-being, but to their physical well-being as well.
Yeah, thanks, Chair. You took the words out of my mouth there, really. In terms of the Community Safety Partnership, we do work very much as a partnership, partner organisations playing their part in creating that broader feeling of safety. And it can be really widely construed. Obviously we have a strategic priorities within the plan, and you can obviously pick off things like tackling drug abuse as being quite directly linked to health. But I think the antisocial behaviour elements, it can be widely construed around some of the work we've done on road safety, really positive figures on reductions in child casualties on our roads, and all of that contributes to a safer environment. If people feel that it's safer for them as a pedestrian, that obviously has a positive impact on their activity levels. If we can achieve things like modal shift from children being chauffeured door to door to school in the morning and in the afternoon, if we can even break that cycle to a small extent and have some sort of park and stride option, then that has obvious benefits. Again, not just on physical health, but I think on the bonding opportunities that provides for children who otherwise would be sitting in the back seat of the car, probably not getting much conversation from mum or dad because of the sort of stress of the journey to school. So if we can encourage those sort of things, then it's all these little elements of nudge behaviour that we can overall improve people's lives. But yeah, I'm happy to discuss any sort of relevant aspects of the report to this board. We obviously presented to the Overview and Scrutiny Committee in December, where they were able to ask quite extensive questions about the specifics, but hopefully between us we can field any questions that members have.
Thank you. And obviously within the report, the strategic priorities for the Community Safety Plan are there, and they have been garnered through the 5 organisations that own the plan and public consultation as well. Just Ian or Alan, was there anything that you'd like to say?
No, there's only a few things I'd draw people's attention to. This year we've been really excellent engaging with the public for the direction of the strategic assessment. And typically we've rocked in with 100 results to our survey, which is fairly paltry. This year we've cleared almost 800, and there's lessons to be learned. And it is important that it's driven by that engagement and it accurately reflects what's going on in the outside world. It's just to say that the plan obviously doesn't operate in isolation. Many of the groups around this table have representatives on that board, and I'm grateful for that because it actually weaves into Medway much better. So there is an acknowledgement from us about the commitment to the board from everybody.
Thank you. Ian, Alan?
Thank you very much, Chair. I think it's important for us to acknowledge the comments and feedback that we've had on our new CSP action plan for 2026 through past boards such as this and the scrutiny panel in relation to misogyny and us tackling to increase the safety and the feeling of safety within the community. We've got new law that's launched from the 1st of April, the Protection from Sex-Based Harassment in Public, which allows us to take single incidents for any person who is targeted due to their sex or perceived sex. That's been woven into this action plan, woven into the proposed new PSPOs, the updates to those, for all the partners that we can work together to tackle elements there. There are probably a number of elements that I can discuss, but I'd rather open it up to questions.
Got Leanne next, please.
Thank you, Chair. I mean, I think this is a very well-written report. Health and Wellbeing Board, I wonder if there's an opportunity for us to look at this in a slightly different way. I say that because there's a very strong definition of what is community safety in this report, which is right and proper. But there are 300 children in Medway who are on child protection plans who are at significant risk of harm. Where do they feature? Because it's dealt with differently. We deal with that differently in terms of our systems. And I'm wondering, as a Health and Wellbeing Board, if we couldn't begin to look at all of that in the round. Because I know that children's services, children's social care in Medway need help. Parents need help to drive that number down because it is an awful number. It's a really awful number to have in Medway. So while I totally agree with this, my challenge is how do we bring these things together as a Health and Wellbeing Board, Chair? Thank you.
I think that's a really good challenge. We heard from Kelly's team before about the way they monitor families with a history of recidivism and other elements of offending, addiction, domestic abuse. And I think actually it's quite right for Leanne to say the profile of those children at risk isn't very obvious in this plan. So I'll give you time to think about how we're going to tackle that together and take some other questions. Okay.
Yeah, thanks very much, and thanks very much for the report. I think it's equally like Leanne saying, I think it's an excellent report, and I'm really, really pleased to see how it's come through. I've got a couple of issues, if I can, within that. One of them, I'll start with the sort of more specific ones, if I can, and this is around. I'll get to that point about the issue around children as well in a moment in relation to one thing. One is the role of CCTV. We've just opened our new centre at the council. I've seen it, it's amazing, and the coverage is excellent and stuff like that. And in terms of how that's working and how much benefit that's bringing to your system, it'd be interesting to hear your reflections on that now that it's up and running and we can see it working and stuff like that. It'd be nice to see how that's affecting what you're trying to achieve here. I think it's a good thing. And in particular, a couple of areas. One is in relation to our active travel agenda. We're introducing our new real-time information screens at all our bus stops with cameras, and that will improve the feeling of safety for particularly people travelling late at night, particularly for women and girls travelling as well on buses and stuff like that. So again, just a reflection of it. Again, it's a camera-related issue, how people react to them, because there's obviously the opposite side of cameras where people feel they're being watched and they don't like that kind of thing. So that's one specific question. I've got some other points, but I'll stop there for the moment.
We've got Leanne's challenge to deal with first, and then perhaps take Simon, then I'll come back to Simon for the next thing, please.
I think your comments are excellent. I agree with them completely. And what is representative is the plan's only as good as the information that comes into it. And as you've identified, we undertake this survey. We're talking to people about people that are very unlikely to engage in that and to see that reflected. So I think our takeaway is that when we redo this, we'll have a bespoke meeting, me and Neil, with somebody from your team, Leanne, and we'll make sure that that's factored in with police colleagues and it's represented as that challenge. Because as you said, we're talking about not a silent issue, but an issue that you actually need to be aware of to factor in. So yeah, I think it's an excellent point, and it's a strand of the report that doesn't just answer itself, it will feed into a wider benefit for the whole of Medway.
Thank you, Ian. And I think at the beginning, Alex alluded to the way that, some of our policies are focused on the well-being of children, but perhaps being a bit more explicit about that is a useful thing to do. Simon's question then, please.
Thank you, Chair. Thank you, Councillor. I can say from a police perspective, the work that Kindy has done in relation to the CCTV, the partnership working, coming to the partners, try to understand blind spots and the work that's been done to counteract that, new cameras going in, the upgrade of the quality of the cameras have directly led to our investigations for us to hold offenders to account. We have seen that. Certainly within the new cameras within Rochester, Blue Ball Car Park, and within Gillingham Town Centre. We've certainly had positive outcomes that have led directly from those cameras and the camera operators. In relation to the RTI, we've actually had a conversation in relation to that recently, and about rather than that just being a separate system, about how that's going to feature into the Kent Police control rooms, and we're going to be able to look at the cameras there. We're going to be able to advertise them as safe spaces covered by CCTV with simple language, simple identification, so that we as partners can utilise that to the benefit of all. So those discussions are happening, and I can obviously on record say I'm very, very happy with the CCTV coverage at this time.
If I can just intervene before you come back, Simon. It's very good to hear that. I've been to the new centre as well. I'm very hopeful that the great facilities there will be replicated across the whole of Gun Wharf. Looking forward to that in a period of refurbishment now. But I think one of the things that is quite striking, it is, first of all, every single camera in Rochester has been renewed for the first time for ages, and that was long overdue, and every single other camera has been reviewed to see about its operating efficacy, and I do think it's worth explicitly mentioning the work of Manager Neil Young on doing that and insisting that it happens. And the ways of working in Kindy have been changed. So you know, Neil has done a lot of work to ensure that people take proper breaks, that their attention is very focused, that they're in an environment where, you know, they don't just kind of get burnt out, because it's easy for that to happen, and change the shift patterns so that people are not trying to work very, very long shifts in order to get a shorter week. It's just not appropriate in that environment. So it's really good to hear that those changes have made a difference to the way that we tackle crime. Simon, I'll come back to you for your next part.
Yeah, thanks very much. And actually, goes back, and I hadn't really picked it out, but I will now, is in relation to the priority on drugs and alcohol, priority 3. And this is about issues, and I find it a lot in my ward in Luton, and other colleagues have found this, and a number of times you're going through your ward and that whiff of cannabis hits you going past particular properties and stuff. It is so common that it's almost unnoticeable now. It's got to that stage where you don't even think about it. And I suspect within the context of that, I know you're doing your best as a team and trying to tackle this, and you regularly hear people that houses have been raided and they've got all the plants and they've taken them all that. It's a never-ending issue for you to tackle. So I just wondered if any more reflections on how that's being dealt with, and do you feel that you're actually gaining ground, or is it just getting worse and stuff like that? So they'd be interested to know about that, because then obviously cannabis leads to so many other issues in relation to health and well-being alone for this board, but in so many other areas of crime as well. And in that respect as well, and it has happened, the primary school in my area is a victim of this, and the children there, recruitment of young people into that world is common, and that reflects back on your point, Leanne, about how we keep children safe. If parents are involved in the drugs, and often the children are as well, or they're victims of it in some way, that kind of thing, we all know the sort of stories around that. So again, that's just that story about whether you feel you're actually gaining any traction at all. Because from an anecdotal point of view, I'll get to what I mean by that in a moment, I can't see it getting better, to be honest. So that's a question around that. The other question that I'm really pleased about, and really it's about identifying how more you can do, is data is king in everything you do. Anecdotal stories from counsellors about drug issues isn't going to help solve the problem. Data is going to help. How is the data supply going? How is the data collection going? Are there areas where you feel that you need to really, we wish we knew more about X, Y, or Z, that kind of general question about it, and therefore how can we help as a council in working around that? Because in any area of work we do, whether it's everything from waste collection right through to buses movements and crime and everything else, and health and wellbeing, data has to rule about information and how we then use our resources to tackle it. The other, I'm covering the ground a bit, sorry Teresa, the other area I'm picking up on, two more bits is in relation to fire and rescue and the wildfire issue. We had 4 periods of drought last year when temperatures really got high, lack of rain. We've had not a lot of rain even in the last few weeks, so we're heading into another hot summer as being predicted within relation to our climate change issues. Wildfires are common. The green spaces teams and the contractors tackle as best they can by cutting fire breaks around any areas of housing adjacent to parks and keeping those clear and stuff like that. But obviously that's an issue about the risks involved around fire generally because of the hot weather we're getting and stuff like that. So it's just a sort of general point there. And my final point, and I think it's page 110 of the report. Just let me, or in my papers rather. Sorry, I'll pull this up. It's background and data information section in the report. There's no mention of the council strategies, page 42 of the report. Or is it 110, sorry. Yeah, no, page 42 of the actual report, apologies. You've got a long list of all the various departments and data sources and stuff like that. It'd be nice to see our One Council Medway plan in there. It'd be nice to see particularly other sorts of plans that we work on, the local plan, any other strategies and plans that are relevant to this. Would be nice to see those referenced there so that people can see that broader context of how this fits into our other strategies. That's my points. Thank you.
Thank you, Simon. So I'll let you come back to Simon before I come to Andrew, please, because he had quite a lot of questions there, didn't he?
So I think it makes perfect sense for me to take the first two and then probably expand on the data collection. I can tell you that there's an awful lot of work that is being done in relation to drugs. I can tell you that there is a specific focus, certainly within my team, within wider Kent Police response within Medway, specifically in relation to drugs and young persons. My child-centred policing team focus a lot of their time and efforts is engaging with those who are the children in, have children in need, or those young persons who we think are susceptible to serious violence, knife crime and drugs. Certainly because we believe that that has a significant impact as an adverse childhood experience for them if they are caught up within criminality, not only criminality where they are targeted, but more specifically within their households. On a daily basis, us as a leadership team, we discuss those incidents, any reported CAS, any intelligence that come to us, and I utilise my neighbourhood teams, our beat officers, and our child centre police team to have interventions with those young persons to go into the addresses, to carrying out welfare checks and to gather more intelligence. We have gone through a operating model change last year in relation to our neighbourhood policing team, which has increased so our officers' availability. So every ward within Medway Council has their own beat officer now. We have our neighbourhood task force teams and we have our town centre teams. Drugs and the organised criminality that falls from that form part of our control strategy. So they form part of everything that every officer and staff member have a focus on. Do I think we're making a difference? I see the positive results. I know the results of the warrants that we've taken place. I know the recorded offences of drugs possession have increased, but that's because we only record those when we locate things. So I know that we are locating more. It's a double-edged sword. I don't want to see recorded incidents of possessions of drugs or drug supply going up. I would like to see that going down. But I know volumetrically we are dealing with more, we are tackling more, and we're not tackling it in an effort to just deal with what's in front of us. What we do then is do a lot of preventative work within part of the CSP with our partners to how can we change behaviour, how can we change attitudes moving forward. We don't want to criminalise young people. We have a youth justice board which focuses on education and rehabilitation and moving people forward. And that's what our focus is. But we will continue to relentlessly pursue anybody. Moving on to data collection, and again, it feeds into what you're saying, especially when you were specific to your constituency there. The more we know, the more we can prioritise our resources. The data collection for me is I would want more people to report anything and everything. Let us be the judge of what we can and can't do. Because if the more we know about things, the more prioritised areas that we can focus on. I will always ask for yourself as partners, as councillors, to prioritise and promote our My Community Voice. It is our ongoing survey with residents where we can have a two-way communication with people so they can register concerns that they have in certain areas. We're utilising it in relation to violence against women and girls, about areas where people feel unsafe, so we can patrol those areas. But not only that, It's where we set our ward-based priorities. We do a you said we did. We ask for people to tell us what's most affecting them in their areas. We then utilise that to set our 3 priorities, which our teams will work on for the next 3 months, and then feed back what we have done about those specific issues. So the more people we can have signed up, the more people feeding into that, the more people reporting. And remember that reporting isn't just picking up the phone anymore. You can go online to report. You can go into the police station to report. There are different channels to report. The more we know, the more we can act.
It's just to carry on from what Alan said. From a council perspective, lots of the things that we have are conditional on having a complaint. You know, one of the topics that spreads from this plan, our plan to this board, is about underage sales of controlled products. There's a prescriptive Home Office policy that says you can't carry out a test purchasing exercise unless you've got complaints, unless you've got intel. There's a real deficit in people reporting these issues. So if you're out and you believe there's something that needs looking at, we need that information. It enables us to do this. You know, I appreciate I'm of a certain age, but the number of reports has really dropped off. And it's not to say that situation has improved. The products are varied. Instead of alcohol, we're talking about vapes, we're talking about these, but we need people to report those concerns because that enables us to do this. Everything in these services is data driven, and if people in certain areas don't report, then there's a perception that there's not a problem there. So it's in everybody's interest to get the most accurate picture possible, because then we can use those resources in the areas that are most needed. But just think of that underage sales. It doesn't matter what anecdote I have, legally I'm not allowed to do a test purchase exercise. So please report on that, because that causes me concern. In answer to your issue with wildfires, if you don't mind me, I'm not going to pretend to be a fireman. I'll do that as a takeaway with Kent Fire and Rescue. Is that all right? As much as I might want a job being a fireman. And in terms of your comment about putting those specific documents in a wider council sense, yeah, I think that should be the opening framework, that this document is written in the context of this world. And we can maybe have that as an opening paragraph, and then the specific documents that have been referenced sit underneath it.
Yeah, thank you, Ian, because we can take that as an action, I think. Coming back to you quickly, Simon.
Yeah, very quickly.
Andrew waiting. Yeah.
Thank you very much for those responses. Just a couple of things. I pick up that point about reporting, and has dropped. So, I mean, we do try and get a message out to the community as much as we can, but I'll pick that one up and take that away for myself to make sure that my residents are happy to keep reporting, because it is a problem. And the other thing, just a huge thank you, because the officers from the council and from your team, Alan, on the ground in Luton are very visible and doing a great job, so appreciate that.
And certainly we've got the Combating Drugs and Alcohol Partnership next week, so I'll make sure that particular issue comes there as well. Andrew, please.
Yeah, thank you, Chair. Yeah, I mean, this is a good report. You know, thank you to everyone involved in this work. I thinking about the point that was raised about children. I think unless we understand why children are involved, that's the big question for me. It's where it starts from. It's the root causes. It's not what ends up at the door of the police and other groups. It's understanding what's going on. And I think that's going to be a very uncomfortable discussion to have, actually. But just in terms of some of the other things, in terms of CCTV, it's good to see that the Kindy thing is finally live. I know that's been a bit of a protracted change because of all the problems in the data centre. But I wonder whether CCTV aids investigation but doesn't necessarily stop crime. And whilst, yes, there are more areas covered by CCTV, what we really want to do is stop crime happening. And I wonder if police visibility is the key driver in that, because it links to my question of, you know, one of the survey results that only 21% of residents feel safe in Medway in the evening, and whether more police on the streets, not knowing that if I get whacked over the back of the head, someone on CCTV might be able to see it. So I would, you know, think that's where we should be going. But on the CCTV issue, and let's not get away from the fact CCTV is a really useful tool, there was a report in the press about the lack of working CCTV on South East trains and on our buses. And given the comments in the report about children coming from London boroughs who are based in care homes in Medway, close to Chatham Station, and are they vulnerable to county lines drugs that might be coming down on the railways? So I just wonder if there's a piece of work to be done with partners at South East Rail to make sure that they are investing in good quality CCTV. I just had two other questions really. There was an increase in ASB incidents. I'm just wondering whether that's because we make it easier to report ASB, or is there a real increase in ASB? Hempstead Valley Shopping Centre, which is in my ward, has seen a big increase in ASB recently. Your team have responded really great. I'm grateful for that. But it's quite, what's disappointing about that is all of a sudden we've had an increase in ASB. Yeah, because Hempstead Valley's been a good place, it's a welcoming place, families can go there. But, you know, I'm hearing about more incidents, but why are we seeing more ASB? I think the data reporting is really important, Chair, but it's understanding why some of this stuff is happening is also could be quite insightful. And just on this issue about out-of-borough children being in care in Medway, obviously we want these children to have a safe environment and they're in care for a reason, but I'm just wondering what additional pressure it's putting on services covered by this report. And what are we doing as a council about talking to London boroughs about improving the communication with those London boroughs so that we're much more aware of children coming to the borough before it becomes a problem with the police? Because I'm sure we can put some wraparound support to those children when they come to the borough. Thank you, Chair.
Okay, thank you. So I'm going to ask Ian and Alan to come back, and Kelly, I'll ask you to comment on children from out of borough. Okay.
I'm going to do my best. I think I've made notes on every question you had, but there we go. Let me pick out some points there. Increasing antisocial behaviour. I think there's a big difference here between quantitative and qualitative. Quantitative, I can say that Kent Police changed the way in July last year, I believe it is, in the way that they recorded antisocial behaviour, where now we're having a much more accurate way, whereas we didn't before. We used to record antisocial behaviour incidents which were attended, whereas now we're recording all antisocial behaviour recorded. So what we need to find, when I give you and provide figures to this forum and in other forums and on the action plan, I'm showing an increase. I'm showing an increase of 25–30%. But that's can only be compared to the quality of the data in the previous year. We are at a point where we're looking for the new norm. What I can say is I track antisocial behaviour numbers daily, or I look for any patterns, any repeat locations. I'm also tracking us compared to other districts and the force average of the increase to understand, are we rising more or less? And I'm looking in the town centres and I'm looking at across the wider Medway district, out on the peninsula, out in the rural wards, to ensure that there's not a postcode lottery for service and focus. So what I have asked my team to do is to not only focus on the quantity, the numbers, but actually do community surveys, actually speak to people. Do people feel that there is more ASB? Because what I don't want to be lost is within the numbers and the knowledge of, oh, it's only increased because of X, Y, and Z. I want to actually have an understanding of the community feels. So my community voice engagement, the literal door knocking. I'm your local officer. How do you feel? Well, I know that there's a number of areas within Medway that I've done ASB surveys on, which is literally going door to door and speaking to people. So that's some of the control measures that I'm trying to put in place to understand that. In relation to CCTV, we're on the buses, so with Arriva and South East Trains, we have active partnership with both companies. They form part of some of our CSP meetings that we have, and my teams and investigative teams have very good links in with them. We are receiving CCTV from both partners, which we are able to utilise and have utilised to inform identification and prosecution. So it is something we're mindful of. We do have open communication with both partners, but it is something that I, as the inspector, will keep an eye on to ensure that there are no missed opportunities there. Out of borough children, I know that you're likely to come back on that. What I would like to offer some reassurance is that my child-centred policing team sergeant sits on the desk directly out opposite my office, and I can hear so many meetings in relation to information sharing where he is discussing the number of children and individual children that have come in from out of borough. So I am satisfied that there is information sharing there, but I think your pertinent question was in relation to the amount of effort and time and what resource is going on that. That's very hard for me to say.
Bring in Victoria, who's waiting, please. Thank you.
Thanks, Alan, for the overview of the question, just to make sure I captured the answer. So when another local authority places a young person in Medway, ideally they should request a risk assessment from us in respect of the area that they're placing their young people. We've had conversations about that here before, and we've had one of Alan's colleagues here to support that discussion. It doesn't regularly happen. When Medway place children in another local authority, we do ask for those risk assessments prior to us placing our children in that area. So if that area is asked, we will provide what we know and the intelligence that we know around that area. And we've got high volumes and pockets of children being placed in areas potentially that we've said actually that's not appropriate, but I guess around placement sufficiency, cost of placements for other local authorities, they make their decisions without, they make their own decisions with the information that we provide for them. There is a statutory responsibility for other local authorities, like there is for Medway, to inform the local authority that they are placing a young person in that area, regardless of whether they've asked for that risk assessment. Routinely, that doesn't happen. As a local authority, when we were placing outside, we weren't routinely doing that. We are better at doing that now.
Thank you very much. So, going back to Councillor Lawrence's comment about actually needing to understand what some of the drivers are of the incidents that you're seeing, I think that we have to recognise that mental wellness is probably a contributory factor. And we, as Kempton Medway Mental Health Trust and Kent Police, work quite closely together already. I think there's just a question about how we can strengthen those partnerships so that we can help to underpin your plan, really, and make sure that we're contributing in every way that we can.
I concur. Very happy to work alongside you and strengthen that relationship.
Anyone else then, please, on the community safety plan? So Eddie first, then Simon. Yep.
Okay, thank you. First of all, I want to concur what you said right at the beginning, because that really struck a note, the importance of feeling safe and to do with policing. And I was thinking about work, so I'm always bang on about this part. It's always relevant. The building I work in residence, there's a significant number of violence, drugs, alcoholism, a lot of antisocial behaviour. And I can think of when there was a spate of instances, and a good case of don't judge a book by its cover, because the person that seemed to be in fear and did not want to leave his room, thereby infecting his mental health. If you saw this 6-foot skinhead, you'd never associate fearful with something like this. So don't judge a book by its cover. I will get to the question in a minute. I wanted to link up the importance of visibility. It isn't just on the streets. So we had a case recently where there was a very serious allegation. Unfortunately, because I don't like this, I have been in a position of criticising the police for the past goodness knows how long, both on a personal level and the cases. But I want to give praise. On this case, we had 2 young police officers, they all look so young to me these days, turn up within under 3 hours. Good thing I was sitting down. But I want to say how good they were. They were so on it, and they actually seemed to understand how to do with people with mental health. That was really important. I did ask if they'd had special training. They said, no, it's just common sense. My point is, they went and spoke to the perpetrator that afternoon, and I don't know how to put this politely. With some of the residents we got, they need to be spoke to very quickly before it's gone in their memory or whatever. That got round the house. You know, when talking to other residents, they feel safer because you turned up. Because unfortunately, there have been so many other occasions when you ain't turned up, but on this occasion it did. So thumbs up for positive. And I asked them about that when I referenced the arson attack in my building, and nobody turned up for several months. They were staggered, but apparently now you've got a new system in place, and that seems to be working. And this then leads to, I want a bit of an expansion on page 74, under women and girls engaging effectively with all communities to deal with key issues and responding to them. Can you just expand what you mean by engaging with all communities, please?
So while you find that, I can thank you. There's no need to respond to Eddie's ageing therapy session. Just to his question at the end, thank you very much.
If we're quoting the first, second, third, fourth, fifth, sixth bullet point, engaging effectively with all communities to deal with key issues and responding to them in relation to violence against women and girls. I can speak from a police perspective as part of the wider CSP. For me, this is in relation to, without repeating the words that are there, where we can only act and react, and certainly as a partnership, when we have that engagement. From, I can give good examples of this within Gillingham Town Centre, within Rochester Town Centre, within the Brompton ward. We've carried out Vorg Walk and Talks. So it is with the focus on violence against women and girls, walking and talking with the community to identify locations where people feel unsafe, understanding the reasons and rationale why people may feel unsafe, and giving preventative and prevention advice in order to do that. When I spoke about my community voice earlier, we're setting priorities. If we have the information, if people let us know that, then we can start to tackle those areas to try and identify the issues and then tackle them together. For me, that's what that means. It's we can only, going back to data collection, but this is the qualitative data collection now. How are you feeling? Why is that? It's not for us to make decisions on what's best to serve the community. It's for us to work in partnership with the community to identify that and work together.
Simon, I will come to you. Alex is coming in with a response, and just before he does, I would like to say to the board, I know how much the community in Brompton appreciated that walk and talk. It made a huge difference and identified some spaces that for the council can help make feel safer. So actually, for the couple of hours that was involved, I think the time involved took bigger steps forward than had it not been spent. So please take that back to the teams. Alex, please.
Yeah, just to expand on that, I mean, certainly I can speak to what's going on in Rochester City Centre in terms of the nighttime economy and the specific VOG-related outreach events that have taken place there. So I suppose that's an answer to how we are sort of responding to community need and communicating with them. But for me, what's great about the Community Safety Partnership is not just gathering the data and having a chat about it and wringing our hands. It's where we're actually able to make a positive change. And you talk about the issues around Brompton and the crime reduction grant we were actually able to use to install additional CCTV on the Great Lines. You know, a direct response to that feeling that people were not observed, didn't feel safe walking their dog or whatever it might be, and actually able to do something practical about it. So I think that's where the Community Safety Partnership it really has its strength. It's both in the ability to bring together all these partner organisations, but what it also boils down to sometimes is a little bit of cold hard cash, and we also have that strategic pot that we're able to dip into and make those, sometimes quite small but really targeted interventions. So I'm really pleased that that's happening.
Absolutely, and I think the activity on the Great Lines was done very quickly in response to that, and it's made a huge difference. I know people appreciate it, women and men actually, because it's a popular running route as far as that's concerned. Were you coming back, Ian? Yep.
It's just to say as well, we try and use parts of the partnership that are best placed to do this. And we take advantage of the Police and Crime Commissioners funding that they give to Medway, and we give very small amounts of money to some domestic abuse services that are phenomenal. If you want to look at the epitome of value for money, that's it. Some of the Home Office funding, we've done this with young people through Child Friendly Medway, and lots of the work that they have done. So what we try and do is we try and deliver it through the best voice for that group, but don't really own it. It takes place in the background.
Absolutely, it's nice to be able to be explicit about it and hear how that happens, especially because these things are happening, I think, in a very timely way under your leadership, Alex. So Simon, for the last comments on this item, please.
Yeah, thanks. It's probably more a takeaway remark, actually. It's just on the basis of you've got the 4 priorities that you've got here, which is fantastic. But the rise of fraud as a crime that is causing so much pain and suffering across the community, I'm just wondering whether you would see it as a CSP issue, and whether, and I appreciate the police are dealing with it, and with so many resources going into it already, but whether it is a CSP issue, that's something that you've discussed already or might discuss future, and whether it would then get added to that list of 4, make it a list of 5, because it is so prevalent. It's just a question maybe for takeaway rather than anything else.
But just before you do come back on that, and happy if you do need to take it away, an element of that is starting to come through adult safeguarding now is romance fraud. And I'm afraid it's an area that's growing, and obviously it links with the work that's done in violence against women and girls, because actually it is a form of violence, people being duped into, in some cases, giving their life savings. And, you know we've got companies in the world acting to make this happen. And perhaps it's not something that we've been as explicit about in terms of community safety before, but I think Simon's right, it definitely is growing.
Medway forms part of a Scam Busters, which is a national initiative, and it's funded, and we take chronic scam victims and we carry out visits to them. That's great. But most of what we want to do is use their information to get it out there in social media to make people aware of these. The Scam Busters are great. They are the epitome of puns. So if anybody wants to do it, there's an ability to become a scam ambassador. And to do these things, and to be there in the community, and to recognise this. And you're absolutely right, Councillor Murray. At certain points in life, we all have weaknesses. And I might be looking for love, and they exploit that. Alan might want a Ferrari. They'll look for that. And it's about this. Part of the problem with fraud is people feel as though they've been stupid. They've not. They've been a victim of crime. And that's a massive message. And I'm speaking on Alan's behalf. I know the Kent and Essex partnership on fraud that they've got with the police. They do a huge amount of work on it, whether that's on doorstep crime, whether that's on credit card fraud. So there is a lot of work that goes on. There's a bit of a shameless plug about the Medway Council's public protection website. Lots of the scam stuff goes on that. If you can encourage your residents to subscribe to it, they'll have access to lots of this information. But you are right, what's really concerning is there is a stigma to being a victim of a scam, and it shouldn't be. You're talking about, as you said, you're talking about a professional industry that exploits that. And as people are at a weak moment, that's what they do. So thanks immensely for raising it, Councillor Curry. And we are doing things. It is a pitiful, when you meet these people, it's a pitiful situation. And if we prevent a few people going in that territory, then that's well done.
Yeah, thank you. I think certainly collectively we can make sure that people put that out, and we'll send out the link to the new website. And I think as well, for our adult social care practitioners, it is something to look out for in terms of safeguarding, because I'm afraid it is growing and affects vulnerable people. Alex, you wanted to come back as the last speaker on this item, please.
Thanks, Chair. Yeah, we were talking about data gathering, and it's really important, the survey that we carry out to identify community priorities. But I'm really conscious, always conscious, that these sort of surveys inevitably don't pick up the sort of crimes that Simon's talking about, the ones that relate to shame, where there's maybe a perception of shame at being a victim. And I think it is something that we have, certainly turned a corner, if not made the journey yet. But you know, in terms of sexual offences, where we had a period, well, until not very long ago, where you know certain sections of the press would have reported on what the victim was wearing rather than the actions of the perpetrator. I think there is now much better reporting of these things and appropriate targeting of our opprobrium on the culprit. But actually, you know, when you look at those priorities that are listed in our survey, I'm struck by a meeting that I attended a couple of weeks ago at the Howard School, where I met with the policing minister and the Shaba Khan MP, and we heard from a charity called Charlie's Promise, which is a guy whose 17-year-old son was killed, was stabbed to death only a couple of years ago, and he's devoting his life to the promise that he made to his son on his deathbed, essentially, that he would do whatever he could to challenge that. And I think what shocked me, actually, and it's not really mentioned anywhere there, and I'm not suggesting for a moment there's anything wrong with the way we do that survey, but speaking to the boys around the table, you know, and they were a real credit to their school, and there's absolutely no suggestion that the Howard School has a particular problem with this, but I was really impressed with the contributions of the boys there, particularly because they were able to say they were scared. You know, and that's quite a big deal for a teenage boy to admit that he's scared in front of his peers. And so, you know, certainly a fear of knife crime is something that I think, you know, is certainly something that we should be looking into, because they had an awareness of, you know, when I'm walking down the street and I see someone with their hands down their jogging bottoms, I just think, oh, it's a bit disgusting, doesn't it? But they're really well aware, they're attuned to what that's meant, whether it's true or not, what that's meant to give the impression of is that that's someone who's carrying a bladed weapon. And they were really aware of that. And, you know, I was just struck that we don't hear that enough, and surveys like the one we carry out, important as they are, don't always hear the voice of children, of young people, and of people who are potentially victims of a crime that they might feel a little bit embarrassed to admit the fear of. So I think we have to do better on that. I'm not sure whether there's a simple solution to the way we gather that data, but you know, if you look at that and say the priority percentage for people using or dealing drugs, 69%, I know those people have given those answers in good faith. I don't think 70%, you know, 7 out of 10 people in Medway are on a daily basis encountering those incidents. But it's important that we know about the perception, but it's equally important that we dig a little bit deeper and find those issues which aren't necessarily being recorded, but are no less important to pick up on. So, you know, I'm open to that. We hold a quarterly meeting of all our partners, and it's certainly that's scheduled for next week. So I mean, that's certainly the sort of thing that we can sort of pick up in those meetings, and you know, constructively look at how we might expand. You know, I don't. The strategic priorities are there for a reason, but I think they are deliberately and appropriately widely construed. So I think, you know, that you can certainly cover a wider range of offences under broad definitions like antisocial behaviour. It's certainly antisocial behaviour to defraud people. You know, we are not bound by it. We're not restricted by it. I think all the partners are constantly looking at the picture of Medway as it is, rather than how it might be perceived. So the work continues.
Thank you, Alex. We've got, you know, actions to share. We've had several examples, and it's really a helpful undertaking to say that you can take that to the next meeting of the partnership. And I think it's absolutely right. Those strategic objectives are broad brush, and intentionally so, to keep the thing live and scoop in you know, intelligence and information from the community about the way people are feeling. So thank you all very much for making the time for coming today. We've got some thoughts and actions, quite clear actions from that. And so is that okay for the board to accept the recommendations, and we'll make sure that the actions that we've agreed today, like sharing the links about the website for you, Ian, and some of the other things that Stephanie will have recorded, form part of the reportage for the committee. Is that okay, everybody? Right, thank you. And thank you very much, Nicoletta and Matthew, who joined us a bit later, for waiting. We're looking forward now to hearing the Corporate Parenting Board annual report, and actually some of the things we've just discussed are mentioned here, aren't they? Particularly, it struck me, in relation to hearing those voices and making sure that we formally put a place for some of the voices to be heard. So with that, I'll let you introduce the item.
Thank you, Chair. And I think listening to everyone's presentation and comments, you can see the thread, isn't it, through everything that we are doing, linking not just the adult level, but children level as well. So I think we are on the right path there. I just wanted to introduce the report, and I'm not quite sure how long we have. Can I just check that so we know how to pace ourselves? Okay, I'll try and be as quick as I can. I think I am presenting the Corporate Parenting Board for 2024-2025. And I think this report was shared in a number of other overview and scrutiny, corporate parenting boards. So some of you might have seen the report already. But I'll just go through very quickly through the slides. I just want to mention that together with the agenda, we also submitted the Corporate Parenting Board strategy, which was reviewed and renewed last year, and it covers 2025 to 2027. And just to highlight the fact that the strategy underpins the Corporate Parenting Board, the work that we do in there. Councillor Price is the chair of the board, so that kind of give us the vision and the impetus in terms of what we need to get to and how to best deliver to children now in care and our care leavers. I think I will, obviously, because the data refers to 2025, I will just provide some updated information in terms of how we've managed to improve on our performance on a number of key performance indicators. You would have seen in the report that the number of children in care has gone up. This is a trend that we have continued to see in 2025, 2026. But while we see an increase, okay, so because I'm looking at my slide, while we've seen an increase in number of children in care, I just want to reassure the board that we've seen a decrease in terms of the number of children coming into care. And there is probably a slower exit in terms of children leaving care. So that's why the overall number keeps going up year by year. But what Ofsted told us in September when they visited us for the focus visit, they are confident that the right children are becoming looked after at the right time. So that gives us the reassurance that we are looking after the right children and we're not bringing children into care when we don't have to. In terms of our care leaver cohort, we've also seen an increase in terms of our care leavers, and that is kind of following the trend of seeing an increase of number of children being in care at the moment. And we have had an increase in terms of our UASKs, and we know they are coming into our care, previous slides, at age 16, 17, which obviously gives us an increase in terms of number of children leaving care at the age of 18. I think it is important to note that we have seen significant improvement in terms of number of care leavers accessing education, employment and training. I think where we've made some progress in terms of numbers in 2024, 2025, at the end of March of this year, we've had 74% of care leavers were in employment, education and training, so that far exceeded the target that we've set for ourselves, which currently sits at 60%. And in terms of our care leavers living in suitable accommodation, again, I think while we saw a dip in 2024, 2025, we've recovered on that quite well. So we currently have 90% of our care leavers living in suitable accommodation. So that, I think, is credit to our joint working with our colleagues in housing and our colleagues in fostering as well, because we have a number of our care leavers remaining living with their foster carers, which I think is really positive to see because they provide them with that level of stability that they need. The report that you've read obviously was based on the previous corporate parenting strategy, which had 8 priorities, and they're all on the screen there. I'm not going to read through them in the interest of time. But the new strategy, I think we've looked at it when we reviewed it. We reduced the strategy from 8 to 5. But equally, I think it covers the main areas in terms of what we've heard here today about children feeling safe, children experience stability in their homes, achieving permanence for them, meeting their health needs, meeting their educational needs, their need for accommodation, and to support them to develop those independent living skills. And more important than anything is to listen to their voices, which shapes our practice every day. The next slide is, I've kind of highlighted some of the, I think that what we need to celebrate in terms of our participation and engagement. Obviously, we have our youth participation, we have the Medway Children and Young People Council, our children and care leavers, they sit on the corporate parenting board and they influence in the policy and the decisions that are being made. Back in January of last year, we launched the reverse buddying scheme, which allows, I think, us as professionals to support and coach and listen to our children in terms of their own experiences and for us to learn from them what we should be doing better. We have been using our Mind of My Own app, which is another tool and an app to engage our children and young people and obtain their views. And also, I think we take every opportunity we have to just celebrate our children and young people, and we organized a number of events in 2024-2025. As part of the report, you would have read about, and I've already made reference to children being looked after when is necessary, and that we need to probably strengthen and do better in terms of supporting families and offering that early permanent support and early permanency planning meetings to happen as soon as possible to ensure that children can remain with family members where it's safe to do so. And we've heard conversation around the kinship pilot that we've been part of. It is about strengthening our family group conferences to ensure that family are being provided with that opportunity to sit together at the earliest opportunity and come up with a plan of how they can support the parents and ensure that the children remain in their care. While I think we've seen a slow kind of exit in terms of children leaving care, I think it is positive to raise that in 24-25 we had 43 children who returned home to their parents, and that is not a decision that we take lightly. We do quite thorough assessments just to make sure that it is safe for them to return, and we are following the NSPCC reunification framework in doing so. Where we can't achieve permanence for children through returning them to parents, returning them to live with family members or adoption, we do ensure that they are long-term matched with their foster carers. And that's an area of ongoing, I think, progress for us and focus. Back in 2024-2025, we long-term matched 22 children, but last year we long-term matched 47 children, so we've doubled the number. And that is because we increased the number of permanency panels from bi-weekly to weekly, because we need that increased scrutiny. And obviously we're working very closely with our adoption partnership to ensure that adoption plans are progressed timely for children. I've already mentioned about the improvement that we've made in terms of education, employment and training, and how that ties in with our plan around developing independence and independent living skills with our young people. And I think just to mention the significant role that our aspiration officer plays within that, and that is also credit to the strong working relationship we have with our virtual schools and external partners. On the health and well-being, because obviously that's the health and well-being board, There are a number of areas that we have continued to focus. Obviously, when children come into care, they have a number of assessments. The initial health assessment performance has always, I think, has been an issue for quite a while. And myself and Nancy Sayer from the ICB, we've had meetings in terms of how we can tackle this, because I think year on year we've seen that that is a challenge, and not necessarily with our in-house services in terms of Kent and Medway, but for children being able to access timely initial health assessments when they're placed outside of borough. So we've got an action plan that was developed as part of the health subgroup, because under each priority we have a subgroup that looks closely into what needs to happen next. So working together, we're hoping to tackle that and just improve compliance in that area. With review health assessments, where we have a bit more control and more time to plan, I think we are seeing that the figure is much better, and last year it sat at 95%. We've already discussed about the importance of timely access in terms of mental health support for our children and young people, so I'm not going to labour the point there, but we are welcoming the Medway Therapeutic Alliance that obviously came live in April of this year. But I think it is important to say that we had a very strong working relationship with the SIT program that was in place before, which is short intervention therapy. And I think that it is quite reassuring for practitioners to know that we have that kind of easy access in terms of those resources. And I think what is to be celebrated as part of the Medway Therapeutic Alliance, obviously there are clear pathways for children in care, for care leavers, and for children open to youth justice service. The key objectives for 2025-2026 are listed there. So obviously one was to review the corporate parenting strategy, which we've done and we've attached to the minutes. And the other 5 priorities are mainly around safety, which we've covered, stability, independent living, live a happy and healthy life, which comes under this board scrutiny, for children to achieve their best potential, so that it links with education, and for strengthening children and young people's voices and influence. And obviously for us to timely respond to the national reforms, because there is a lot of change to come. We've got Matt here today, because obviously we've been talking about health, we've been talking about participation and listening to children's voices, and I think we wanted to showcase how well we've been working together in terms of making sure that we triangulate all of this. And I think I will just hand over to Matt to tell us a bit more about what that has looked like and what the impact has had.
I will be as swift as I can because I'm mindful of time, but as a project officer sitting within the partnership commissioning team that's between public health and the ICB, I'm part of a team of very committed colleagues who want to improve health outcomes for all young people across Medway, but with a particular focus on those care leavers. So the Medway Therapeutic Alliance, which has been mentioned, for instance, it was great to see colleagues from North Kent Mind at the Elaine Centre on Monday afternoon this week for a health and wellness event. There with the care leavers, promoting that care leavers pathway and seeing those conversations, even from us across the room on Monday, was fantastic. I've had the pleasure and the privilege over the last 18 months of getting to know some of our care experienced young people across Medway, to work with them for something that we call our Care Leavers Video Project, where, in a nutshell, we are around the corner from Mid Kent College. They have a creative media course where we have worked in partnership with Mid Kent College to produce informative, engaging health videos to help really build those skills around independence and health access for care leavers in a way that resonates with them. So you've got content being made for young people, by young people. And in the last 18 months, probably the best day that I have had in my job has been sitting there at Mid Kent College, Dragon's Den style pitch, where it was myself, colleague from the ICB, someone working in partnership with young people and a young person with care experience themselves, to listen to group after group come in and pitch ideas for what they think resonates with them. So today I'm really pleased to say that we've made videos on GP registration, we've made videos on dental appointments, we've made 2 mental health themed videos, asthma awareness. We've literally got students working through half term as we speak on a vaping video, which is really positive, and it's being hosted on the Medway Council website as part of the local offer. And then this is where it all gets very scary for us, not in the target audience of 18 to 25. Those videos have been shared on TikTok. They've had 250,000 impressions, which is a lot. And the part that makes my brain spin there is, of those 250,000, how many of those are seeing that information for the first time, or were unlikely to go and view it in perhaps conventional ways of sharing that information. So there's been so many great outcomes to that, so many lovely case studies of students learning soft skills, but most importantly, it's a sustainable resource for the future that care experienced young people can learn from, and we're looking at how that can develop beyond health as well, because in all that engagement with care experienced young people, there's so many other topics they want covered.
Thank you both. I'm really impressed, and I'm sure other board members are, with the intentional tone of the strategy itself, you know, the sort of message that is coming to young people about what will be done for you. And actually to have a sort of agenda of health where the young people make the videos themselves and send a message to each other. That's really great work, Matt, and I'm sure it was enjoyable for you, and perhaps on another occasion, or even at full council, it might be nice to see some of those videos, because that, you know, that work has gone into that. And actually, the voices of young people across the board in health are not heard very loudly, are they? You know, we don't see those voices, particularly in things like GP, patient and public involvement groups, very often. So it's really nice to have a forum where the young people can come across and say that. And actually, one of the things that occurred to me, to get an 88% result of children in care getting dental checks is really good, because it's pretty difficult to get the wider population to have dental checks. So, you know, great work on behalf of our young people. Sad to see that we've got rising numbers, but I do think the adoption partnership and other things that we've done have made it more possible to get people into situations of permanency, even when they've been through that difficult situation. And out the other side, some lovely things in here, still keeping in touch with people when they leave care, still writing to them, still doing what parents do when the children actually come away from home, is really positive. Adam, I know you've been a fantastic advocate for this strategy and have been promulgating it in lots of different places, so it's nice to know that you've got something to say to us today. Then I'll take Eddie, and then I think that will be... sorry, and Jackie's coming in as well. Okay, thank you. Sorry, I must look right more often, but not in the political way. Okay, thank you very much, Adam.
Thank you. Thank you, Teresa. And just to say, first of all, thank you very much to like Nicoletta and Matt for a very powerful but also concise and presentation, because whilst we've got thousands of children within Medway, there are 500 plus 200 that we want to pay particular care and attention to, which is the ones which are either in our care or have left our care, because we and I, as the chair of corporate parenting and the lead member for children's services, am deeply honoured and privileged to hold the role of lead member for children's services, but also chair of the corporate parenting board. And as you yourself, Teresa, have mentioned to me before, I might not have any of my own children, but I have got responsibility, and I do have an impact on 500 children who are in our care, plus 200 who have left our care. So thank you for reminding me about that. But it is one of the best aspects of my role, and I'm really pleased to be able to work with colleagues across the political spectrum when we come together for the meetings of the corporate parenting board. But when we're sharing the achievements of our looked after children as well. And the last time that we were able to do that, we had a surprise guest in terms of Kelly Holmes, who actually came along, and the looked after children there were absolutely gobsmacked and starstruck because she is a living embodiment that if you set your mind to it, it doesn't matter what kind of start in life that you've had, but you can achieve. And bless her, Kelly Holmes really delivered the gold medals for us, etc. And she does live within Kent, and it was magical that she came along to be able to spend time on that evening when we were celebrating the achievements of looked after children. Also, just wanted to allude to the fact that part of those 500 odd are the 65 plus 20 care leavers, 65. I was going to use the term UASC, but they themselves prefer to be referred to as child refugees. And this is something which this administration has taken on that responsibility, because the former leader of the previous administration didn't want to, it was a bit like King like Canute, he didn't want to have anything to do with foreigners, etc. Well, at least foreigners that he wasn't getting funding for, etc. So that was one of the first decisions that I was able to take, that we as a local authority will take our share, and Councillor Vince Maple and I have been able to go along to follow up on visits made by Leanne Farrick to like accommodation where like some of our care leavers, like refugees, are being assimilated into the like community and are being cherished and getting all those opportunities that we would want for our own children. Also, just whilst I'm just like speaking, just to say that just the other day I took the opportunity to go with my Conservative counterpart. We were invited to the Adoption Partnership South East, and it was really, really lumped to the throat type thing to be able to meet a couple of families who are going through the process of like adoption, which is actually getting that permanency even more than what I'm pleased to say that we're having increased permanency within our foster children care. One of the sets of parents had been foster parents before, but it was really good to be able to see. And then just to finally allude to the fact that I'm deeply honoured that we're one of 7 authorities that have been chosen by the Department for Education to be part of the kinship care pilot. It's 126 million, not for Medway, but across the seven authorities. And as has been alluded to earlier on, we do know of 300 kinship carers, but there'll probably be more that will be able to like come forward when we get the publicity. And also just to say on that if anybody thinks that they might be eligible, they can ring a number which is 01634 336 228. And there is a email address as well, sgo.support@medway.gov.uk. So anybody who is in that role of, on behalf of their family, reaching out and is caring for a child within their extended family, whether they be an uncle or an aunt or grandparent, or even just a significant person in that young person's life that has been able to take on that role, to be able to prevent them going into care, but to make sure that in taking on that role that they are reimbursed for it without necessarily having to go through a means test, because that will be part of this pilot that we're receiving that money for, and we'll be measuring the impact of that. So that's really exciting, but it is also a testament to the work that like Kelly Cocker and her colleagues are doing day in, day out. And the other exciting thing which I was able to do was over the Easter weekend on Good Friday was to go in and visit one of our foster carers who I had previously visited on a safeguarding visit a few days previous, but she invited me to her caravan at the like holiday park in like All Hallows, and to be able to see a caravan there that has been kitted out for respite care for foster children, not just within her own family, because she actually runs the first Mockingbird constellation that we have within Medway, which provides that wraparound care to foster carers so that they're not alone. If one of them has to go into hospital or they've got other issues, they've got their peers like to hand that can like support them. And it was on a Good Friday, and the duvets all had Easter written over it as well, and it was just heartwarming to be able to see. And I'd like to thank other officers from other parts of the council, because as like corporate parents, we do have the subgroups. And I'd also like to thank Councillor Mark Jones for standing in for me sometimes on the participation group, which is the subgroup which I go on to. Also welcome the like participation of other members of the council. It is an honour to be sort of represented, and the aspect which I've enjoyed the most has been part of the like reverse buddy scheme. So I've been matched up with a young youngster, Bailey, he won't mind me using his name, and I get to have regular chats once a fortnight, learning from him about what it's like to be a child in care. He's like fortunately been in a very stable fostering family, and he likes going to the like cinema, and I discovered that there is one film that I've seen that he's seen. He's told me about lots of others as well, so we're able to talk about that. He's able to find out more about what it's like to be a counsellor, so I'm looking forward to more of him and his colleagues in due course coming forward as counsellors in future, representing the community that they've been cherished for and able to live and work to the best of their ability with our support. So thank you very much. And this corporate parenting strategy is going to be refreshed every year, but it is a deep honour, and not least because we've got LGR coming up, and of course we're the only local authority within Kent and Medway which has experience of being a unitary authority for 25 years, and we know that the future pattern of local government within Kent is going to be that all authorities will become unitary authorities, and of course we've got the 20-odd years experience as councillors of corporate parenting, which many of those new unitary authorities won't have had from a member point of view. So I'm sure that part of the work that we're able to do when we get the local government reorganisation is to be able to share our best practice and our experience of being true corporate parents. Thank you.
Thank you for that lovely testimony, Adam, and particularly for the last bit, because it's important that we remember that. I've got Jackie coming in, then Eddie, please.
Yep, I'll be very quick. Mine's for Matthews. Your passion exudes, and it's got me quite giddy. So I know this is specific to care leavers, but I do wonder if there's something that we can do about the young people that haven't been known to children's services but are 18 plus, with some of that the stuff around TikTok, and so I'll get somebody to link in with you.
100%. I think the videos, when you look at them, can be accessed by anyone. I think beyond the scope of the care leavers, there's no reference to the word care throughout. It's just the care leavers local offer at the end. That was from the engagement. They didn't want that care label, but anyone could learn from these videos, not just children, young people, dare I say adults, for instance. And they're now in the public, so they can go wherever we want. Let's be ambitious.
Actually, I'm glad I called now, because that last comment, I was thinking something similar. It's a pity that we can't take this good vibe and spread it around. And there is something about getting to them while they're young. I mean, we've had negative subject matters, drugs and violence, and getting to young people to put them on a good path is so important. I just wanted to say how wonderful it is. This board, the Corporate Parenting Board, is the other meeting, including this one, that I enjoy the most. Not say least to both chairs, Teresa and Adam, because what they do is they enable, I'm such a creep, aren't I? What they do is they enable everybody around the table to get involved and to get stuck in. It's a very enabling and encouraging environment. There was a member that turned up for one meeting and he was removed because he criticised the video that had been done and he just did not get it. No. Thankfully, his leader at the time did and did the right thing. So good to him. And he actually demonstrated the opposite to the approach. He really actually re-emphasised the whole approach. Because he was arguing, you can get this information by Googling, what's the point, blah, blah, blah. Even if that is true, what I was going to say about the videos and the other activities, the very act of people getting together and doing something creative, that positivity, and then that will spread because they will talk about it. That in itself is so worthwhile. And I just want to say it's such a good vibe there. It is so galvanizing. So thank you for allowing me to be on your board.
I'm going to be very brief. It was 16 years ago when I first walked into Medway Council, and I am really heartfelt that the Children's and Young People's Council and that the young inspectors are still working as diligently, because let's be honest, they really give us a run for our money when it comes to developing our services. So I'm really thrilled to see that they're still there, but more to the point, I've got now a list of 4 things that I'm taking back to the Trust as good practice that we should be making sure that we are delivering. So I'd just like to thank you for that.
Finally, please.
Yeah, very quickly. I just wanted to mention my ward colleague, Councillor Howcroft-Scott, who, as you know, has dedicated a huge part of her life to the care of children in fostering and education and such like. And I do get a lot of information on what you do from her, so I'm kind of up to speed. But I just wanted a quick question, not for answering now, but maybe some feedback at some point, would be about how good the foyer projects are doing. We've got 2 in our ward, at Endeavour and at Sunrise, a new one at Sunrise. And it would be nice to know how they're doing from your perspective. I go in there and I see the children, they seem happy, and obviously there's some good work going on within them with the staff and everything, but it'd be nice to hear a bit of feedback from you guys about how you feel they're working. So that's my question.
Thank you, Simon. Kelly's just undertaken to do a briefing note on that, which I think will be timely, and we'll make sure that all of the links that we've said we'd share today, including the ones recently under corporate parenting, do go out to everybody. So thank you all for your indulgence. I hope that everybody accepts that report and some of the recommendations associated with it. I think that's absolutely right to say, Eddie, that was a heartwarming report. You know, these are a group of people who are vulnerable, who mean a lot to us in Medway, and who we want to be successful. And I think when they hear a message that people around this table and other tables want them to be successful, that makes a real difference to them. So I do thank you, Nicoletta and Matthew, for all of the enthusiasm and innovation that you've shown. And it's worth adding as well that our Kelly got a picture with the other Kelly. So our Kelly's more famous than her, really, but they looked very nice together on that particular occasion. So thank you very much for your attendance today. I think that's been a really wide-ranging and insightful meeting. I hope that newer people to it enjoyed it. We'll see you all again in June. I know we've got the work programme. I was coming to it. Thank you. I was coming to it. But if anybody particularly needs to leave now, because I do know that we've taken over time, then we'll come to the work programme when you've had the opportunity to go, because I appreciate that we've taken some time, but I think it was well spent. So our last item is the work programme, and over to you for that one, Stephanie, please.
Just before I go over to the work programme, I just wanted to say that Nicoletta mentioned the work that she's doing with Nancy Say on the initial health assessment. If anybody's interested in that, we are taking an item on the 10th of June, CYP meeting, so please tune in if you'd like to.
That's great. Good plug there, thank you. So on to the work programme, please, Stephanie.
In relation to our work programme, I actually don't have anything to add, but I am able to take any questions.
I think that we probably do need to add neurodiversity, but work. I think it is, but work, now that we've got a new link with Dominic, work with you on when that might come. We'll keep Neighbourhood live, Abby, and arrange the training session accordingly. And I think that they were the main things that we said that we would add this time, because we've got a pretty full programme. So any comments, anybody on the work programme? With those additions, happy to accept it as it is. Thank you very much to visitors for your attendance today. It was really nice to see you. I hope that you got something out of being here as well, and I wish you all a nice evening. Okay.